I will be discussing about in brief I will be telling you about the silence. In brief, I will be telling you about the ankle joint. First, I will be saying something about the ankle joint, and then I will proceed with a very important movement involving the foot. There is a very important movement. Unlike the movements which were learned so far, the name is altogether different. So I will be saying about that. Regarding the ankle joint, these are the bones of the leg, and this is the skeleton of the foot. Right? So these are the bones of the leg. This is the skeleton of the foot. From the front, it is like this. From the back, it is like this. From the lateral aspect, it is like this. From the medial aspect, it is like this. Because between the skeleton of the foot and the bones of the leg, the joint is nothing but the ankle. This is obviously the skeleton of the left foot, and these are the bones of the left leg. Therefore, this is nothing but the left ankle. Now, the bones contributing to the ankle joint are both the bones of the leg, they are lower ends, and a bone of the foot. So many bones are there in the foot, but only a single bone is participating in the ankle. Because from the pedal platform, if the body is skeleton of the foot, it is also being called as the pedal platform. PEDAL, pedal platform. But only a single bone of the pedal platform is contributing, and lower ends of both the bones are contributing in the formation of ankle. Unlike the knee, in the knee, it is only the upper end of tibia which is contributing to the knee joint. Very important knee joint, about which Subrahmanyam had discussed in your last class. I think, right? You will be getting about the knee joint. Next Saturday, you will be getting all about that, about the knee. So in the knee, we find only the upper end of tibia is participating, not the upper end of tibia. But in case of ankle, lower end of both tibia and fibula will participate, and a single bone of the pedal platform will be participating, and that single bone lies on the top of the skeleton of the foot. It is nothing but the talus. TALUS, talus. It lies at the summit of the pedal platform. It is contributing. But the bones participating in the ankle joint, that should be remembered first. The bones participating are এই কথাগুলো একেবারে বেসিক ফান্ডামেন্টাল জিনিস, এই নিয়ে যেন কোনো রকম কোনো কনফিউশন না হয়। ডাক্তারি করতে গেলে এটা জানতেই হবে। তাহলে from above in the ankle, the participating bones are lower ends of tibia and fibula. Lower ends of tibia and fibula. From below, the participating bone is nothing but the talus. The talus, which lies on the summit of the pedal platform. Here, the anatomical name of ankle joint is a name and stop. Ankle joint we also use, with initials also use, because ankle joint. But its anatomical nomenclature or orthopedicians or radiologists, they do not term the ankle joint as ankle joint. They say more often the ankle joint as the talocrudal joint. But the ankle joint is anatomical Tailorhumeral joint. Tailorhumeral joint. Tailorhumeral joint. Talus is participating and both bones of the leg are participating. Therefore, it is tailorhumeral joint. Now, in this joint structurally, a articulated skeleton का तुम यदि नहीं खांसी नहीं है ध्यान, because the bones participating, the lower limb of tibia and fibula is forming a mortise-like thing. A mortise-like thing. The lower limb of tibia and fibula. क्या खांसी नहीं है देखिए, ये लोगों को मिनिस्टर देंगे लोग. This is being called as the tibiofibular mortise. Tibiofibular mortise. ठीक है? In this tibiofibular mortise will be fitting the articular surface of talus. ठीक है? The articular surface of talus participating are. ये talus बोल कर देखिए तो इसका फॉर्म होते हैं. अब देखो लोअर लिम्ब में लो. দেখানো হওয়ার কথা কি কোনো না কোনো টিচারকে দিলো দেখাবার কথা she might be Omnibita madam or she might be Omnibita sir or she sir ঠিক আছে আমার ডিউটি কিন্তু নয় these things you have to ask your junior teacher আজকে আমি পড়ালাম তো এবার যে স্যারদের বলবে আমার টিম শুরু হয়ে গেছে যে স্যার এরকম বলেছে ক্লাসে স্যার আপনাকে দেখি স্যার বা ম্যাডাম যাকে সামনে পাবে বলতে দেখেন কোনো ব্যাপার না কিন্তু বোর্ডটাকে কাছে নিয়ে দেখতে হবে আমি তো এই দূর থেকে 140 জন 125 জনকে দেখাতে পারবো না ঠিক আছে তাহলে পার্টিসিপেটিং সাবস্পেসিস অফ পেয়ার্স is a little bit difficult lower end of tibia and fibula দেখো এটা আমি কোন অ্যাঙ্গেল দেখেছি এটা কোন অ্যাঙ্গেল দেখেছি tibiofibular mortise of the left hand দেখো in the neck laterally so left hand lateral wall of the tibiofibular mortise is longer than the medial one. Lateral wall is longer than the medial one. ঠিক আছে এই আমার লেফট হ্যান্ড আছে এই লেফট হ্যান্ডটাকে আমি লিখেছি এরকম ভাবে upper articular surface belonging to tibia or end of tibia and fibula তাহলে laterally it is longer medially it is shorter এবার তুমি আমাকে বলো from your knowledge of the bones of the leg what does this medial wall represent and what does this lateral wall represent please tell me এই lateral wall এটা কি tibia না fibula আর medial wall এটা কি tibia না fibula বলো medial tibia medial tibia ko lower end of tibia ki very it is nothing but the medial matrix এই যে tibia এই যে medial matrix এই medial surface একটা comma shaped articular surface that comma shaped articular surface is meant for joining with a similarly shaped articular surface of the things. So this is the medial matrix. Shorter in length, and this is obviously the lateral matrix. The end and lower end of the fibula. So this is the lateral matrix. This is lateral matrix. This is medial matrix. And this is nothing but the articular surface marking the lower end of tibia. Lower end of tibia is a more articular surface also. Because the upper articular component of the tailorhumeral joint is nothing but the tibiofibular mortise. Now in this tibiofibular mortise will be fitting the talus. Talus का एक भाग डूबेगा. देखो ऊपर एक ऐसा जिनिस আছে তুমি দেখেছো ফ্যাকাল্টি মডার্ন এন্ড প্রেসার হ্যাঁ দেখেছো তো ফলমুনি বাংলায় পড়ে দেখেছো তাহলে ফলমুনি ওইটা ফলটা ঠিক আছে ফলটাকে আমরা বলি bodies so this is the tubular bodies and this is the vessel this is nothing but the pilus pilus का इधर एक हमारा switch bro now which surfaces of the pilus is meeting একেবারে উপরের যে সারফেসটা আছে that surface is very important that is articulating with the articular surface of the tibia that is being called as the trochlear articular surface of talus. Trochlear articular surface of talus. Now the talus is participating surfaces. तीन के participating surfaces है एक ही वो talus, which is like a vessel in the body. कारण ऊपर surface का वो trochlear articular surface. Medially, there will be a comma-shaped surface for the medial canthus. Now the medially একটা comma shaped surface আছে একটা comma shaped surface আছে comma shaped surface on the medial canthus that's why we have the triangular articular surface triangular articular surface for the lateral manuals triangular articular surface for the lateral manuals and in between the most important surface is the trochlear articular surface. Trochlear articular surface तो तुम्हें talus नहीं देखते, it is like a surface of a pulley. पुली देखे, एक पुली surface है, वो तो एक trochlear articular surface of talus. ये जो करें, हमारा पुली shape बोले, मैं trochlear articular surface of talus बोले, trochlear articular surface. These are the three surfaces of talus which will be forming the angle. Now the articular components are very important. তারপর ankle involving the ankle injuries are pretty common. তারপর আমরা সবসময় দৌড়াচ্ছি হাঁটছি সবকিছু করছি তাহলে physical condition in and around the ankle is pretty common. আদি তুমি যদি ধরো একটা এক্স-রে এলো এক্স-রে দেখে তুমি যদি বনি কম্পোনেন্ট আইডেন্টিফাই না করতে পারো তাহলে কি তুমি ঘোড়াটির অ্যানাটমি শিখেছো তোমাকে তো বডি কম্পোনেন্ট আইডেন্টিফাই করতেই হবে তাহলে রিমেম্বার injuries involving the ankle is not too infrequent but is very common here one has to know the body components participating in the ankle or the joint next এটা হচ্ছে একেবারে কি বলবো দুনিয়ার কথা আমাকে একটু করে বলতে হবে তারপর তোমরা বিগিনার সব কথা সময় নষ্ট করা যায় না Next, it is obviously a synovial joint. It is obviously a synovial joint, quite a large joint. Participating articular surfaces are quite big. I think it is obviously a large joint. Angle joint. It is a synovial joint. What type of synovial joint it is next? You will be asked. Could be getting that it is a synovial joint will not have any anatomy. Because all the mobile joints in our body are synovial and you have to remember the type of each and every synovial joint. তোমাকে আমি এখানে synovial joint আছে between the thigh tissue এখানে between the metacarpal head and base of proximal thigh synovial joint আছে thigh tissue between the bases of metacarpal and the distal row of carpal joint আছে synovial joint thigh tissue তুমি কিন্তু মনে রাখবে তুমি নার্সিং স্টুডেন্ট নও তুমি প্যারামেডিক্যাল স্টুডেন্ট নও ডোন্ট টেক ইট সো ইজিলি আমি কিন্তু বলে দিলাম you are MBBS student you are somewhat different from IBS students from homeopathy students from the paramedics and from the nurse কিন্তু তোমার ক্যান্ডে যদি ফার্স্ট সময় দিয়ে দেখি আবার তোমাকে আমি পাস করিয়ে দেব ম্যানেজমেন্ট তোমাকে পাস করিয়ে দেবে কিন্তু আমি কিন্তু তোমাকে দেখেই বলবো হাজার কাজ এই যে আমি সেই রকম বলছি তোমাকে রেকগনাইজ করব অ্যানাটমি কিছু জানি না জেনে পাস করেছি like each and every synovial joint তাই জানতে হবে as a medic নাচানাচি করলে হবে প্রত্যেকই নাচানাচি হোয়াইট কোট বই করে ডাক্তার হয় বুঝছো ওইসব করে ডাক্তার হওয়া যাবে না তাহলে ankle joint type. What is the type of ankle joint? Ankle joint type hinge joint. You have to say it is a hinge joint, but it is a modified hinge. Just remember this term. তার কারণ আজকে পরীক্ষায় তোমাকে আমি কখনো জিজ্ঞেস করব না যে why it is considered as a modified hinge. কখন জিজ্ঞেস করব যখন তুমি ভাইবা টেবিলে অনার্স পাওয়ার মতো বলতে পারছো অন ইওর ওন তখন আমি তোমাকে জিজ্ঞেস করব otherwise I will not ask you but you have to say type is modified hinge because knee joint is also modified hinge ankle modified knee joint অনেক কমপ্লেক্স knee joint নিয়ে আমরা অনেক কিছু জিজ্ঞেস করি কিন্তু ankle নিয়ে অত কিছু জিজ্ঞেস করব just remember that type it is modified hinge the type of ankle joint it is modified hinge modified hinge that means the joint movement will take place the movements in the joint will take place around a single axis and that axis is a modified transverse point axis টা একটা modified transverse axis এই যে এরকম রাখলে transverse this is vertical this is angular posterior in case of ankle joint the axis will be like this because a little bit tilted সেই জন্য এটা আমরা modified hinge বলছি ঠিক আছে তাহলে axis is transverse এইটুকু মনে রাখো little bit tilted মনে না রাখলে তাহলে axis around which axis টা কি বলো axis টা কি তুমি তো ফিজিক্স পড়েছো তুমি মোটর পড়েছো তাই না বাট অ্যাক্সিস ট্যাক্সিস এগুলোকে নিয়ে ইঞ্জিনিয়ারদের অনেক কিছু ভাবতে কিন্তু তাই বলে তুমি ডাক্তার ভাববে না তোমাকে ভাবতে হবে তুমি পোস্ট লার্ন তার কারণ জয়েন্ট রিপ্লেসমেন্ট চালু হয়ে গেছে নিউ জয়েন্ট রিপ্লেসমেন্ট হিপ জয়েন্ট রিপ্লেসমেন্ট অর্থোপেডিশিয়ানরা করছে মানে তোমাকে অ্যাক্সিস বুঝতে হবে অ্যাক্সিস মানে অ্যাক্সিস will be the stationary thing around which the movement will be taking place গাড়ির চাকা যে ঘোরে অ্যাক্সেল থাকে না ওটা তো ফিক্সড থাকে ওটা তো চাকার সঙ্গে ঘুরবে না ওটা ফিক্সড ওর রিলেশনে রেসপেক্টে চাকাটা that is each and every joint which is mobile is have a single axis might have a single axis might have double axis or might have multiple axis hip joint is a classical example of a polyaxial joint it moves around three cardinal axis and all the axes in three cardinal axis and all the axes in between এই যে কথাটা আমি বললাম three cardinal axis and all the axes in between এর ভিতরে কিন্তু অনেক কিছু ফিজিক্স লুকিয়ে আছে তো I will not do that ঠিক আছে তাহলে in case of hip we find movements are taking place around three cardinal axis and around all the axes in between those three cardinal ঠিক আছে but in ankle joint movement occurs around a single axis that is transverse because and since it is a hinge joint যেকোনো hinge joint আমরা কেবলমাত্র দুই মুভমেন্ট দেখতে পাই কিন্তু মুভমেন্ট দেখতে পাই লোয়ারিং হয়ে আছে তুমি বলো মানে আমার ক্লাসে আমি যখন তোমার সাথে ইন্টারঅ্যাক্ট করব আমার কাজ হচ্ছে তোমাকে আউট আর নিচে আগানো স্ট্যাটিস্টিক প্রেসার আই গট দেখো এমএনসি বলেছে যে ক্লাস হ্যাজ টু বি ইন্টারঅ্যাক্টিভ বড় বড় কথা এমএনসি বলতে কোনো অসুবিধা নেই তো ক্লাস হ্যাজ টু বি ইন্টারঅ্যাক্টিভ করলে মোস্ট অফ দ্য টাইম আই উইল বি দ্য স্পিকার এন্ড দ্য স্টুডেন্টস উইল বি মার্কস দে উইল নট সে বুঝেছো কিন্তু স্টিল আমি তোমাকে ইন্টারঅ্যাক্টিভ কেন করছি সো দ্যাট ইউ লার্ন এগুলো করতে হবে ঠিক আছে তোমার লোয়ার লিম্বটা পুরো হয়ে গেছে তোমার তো বলতে পারা উচিত যে হিঞ্জে যে মুভমেন্ট হয় अराउंड द ট্রান্সভার্স অ্যাক্সিস মুভমেন্টের নাম হবে আপনাদের বলো यस তুমি যে মুভমেন্টগুলোর নাম শুনেছো তোমাকে যদি আমি বলি what are the movements please name a few তাহলে দেখা যাবে তুমি কনফিউজ করছো মুভমেন্টস আর যে মুভমেন্টস গুলো আমরা সাইনোভিয়াল জয়েন্টস দেখতে পাই around those three cardinal axes movements are flexion extension adduction abduction internal rotation external rotation or medial rotation these are the three movements because which occur around the three possible cardinal axes flexion extension adduction abduction internal rotation external because এই তো ব্যাপার hinge की movement হবে flexion extension in joint will allow only the movements of flexion and extension ঠিক আছে তাহলে অ্যাঙ্গেল is a hinge তাহলে movements particularly the angle are কি হওয়া উচিত flexion extension তাই তো হওয়া উচিত তাহলে লেফট রাইট দেয় but actually movements particularly movements is angle flexion extension since it is a hinge movement occurs around a single axis transverse axis flexion extension ever দেখো তোমার এই যে আমাদের রিস্ট আছে রিস্ট ইজ নট এ হিঞ্জ ঠিক আছে রিস্ট কি আমরা যখন রিস্ট পড়াবো বলবো ইট ইজ নট এ হিঞ্জ কিন্তু রিস্টে ফ্লেকশন এক্সটেনশন পার্টিকেল আছে তাহলে দিস ইজ ফ্লেকশন দিস ইজ এক্সটেনশন বলো অ্যাক্সিসটা কি ট্রান্সভার্স এরকম অ্যাক্সিস আছে এই অ্যাক্সিসের এগেইনস্টে এরকম অ্যাক্সিস আছে ট্রান্সভার্স অ্যাক্সিস এর এগেইনস্টে ফ্লেকশন এক্সটেনশন হচ্ছে বলো এরকম ট্রান্সভার্স অ্যাক্সিস আছে ফ্লেকশন এক্সটেনশন তাহলে প্লিজ ডিফাইন আবার এই প্লিজ ডিফাইন flexion extension this is flexion this is extension in case of knee this is flexion this is extension in case of hip this is flexion এরকম পাঁচটা হলো flexion আর সোজা করে দেওয়া extension তাহলে define this flexion by next বলো define flexion extension ফ্লেকশন এক্সটেনশনের অনেক রকম করে আপনি অনেক অ্যানাটমিতে ডেফিনিশন আছে জেনারেল অ্যানাটমি বই পড়বে জেনারেল অ্যানাটমিতে ফ্লেকশন এক্সটেনশন ডিফাইন করা আছে I will not go into so many definitions so many versions of the definition down কিন্তু তোমাকে as a student of medical science নার্সিও ডাক্তারিও প্যারামেডিক্স flexion is nothing but bending of the moving parts. Bending. Extension is straightening. কি করছি আমি এটা wrist I am bending it forward and in extension I am straightening ঠিক আছে this is extension this is extension নিয়ে কিন্তু আরো সহজ flexion straightening the extension তাহলে flexion is bending extension is flexion মানে bend মানে anatomy যদি বুঝে পড়ো তাহলে দেখবে কিচ্ছু অসুবিধা নেই আর যদি না বুঝে মুখস্থ করার চেষ্টা করো তাহলে সবই মনে হবে you can do বুঝেছো ঠিক আমার একটু বলে মনে হবে তুমি বলবে স্যার বুঝার যাবো সত্যি অ্যানাটমিতে ফিজিওলজির মতো বোঝার কি আছে বলো anatomy most of the terms are derived from Latin or Greek বুঝেছো ক্লাসিক্যাল European language about which we do not know anything. We do not know our personal language itself. That is why we find so much difficulty in learning anatomy. Bishop Facial, extension, what is it invented or not? These are derived from Latin or Greek. That is our language হয়ে যাচ্ছে। তুমি যখন অ্যাবডোমেন দেখো আমি পড়াচ্ছি পা চলে যাচ্ছে অ্যাবডোমেন। অ্যাবডোমেনে তুমি যখন কোলন দেখবে নাটটা কোলন is the lung part. কোলনে তুমি তিনটে সেগমেন্ট অ্যাবডোমিনাল ক্যাভিটি লেভেলকে আইডেন্টিফাই করতে পারো। একটা part of colon rising up, ascending colon, a part of colon descending or going down, descending colon, and a part joining the transverse colon. তুমি মজার ব্যাপার দেখবে ascending colon এ গেল এসে এই ঝুলে পড়ে আবার কে আই তাহলে between the ascending colon and transverse colon you will find a vein. Between transverse colon and descending colon on the left you will find a similar vein. Such veins are also called as derived from flexion. Right calling flexion, left calling flexion. F-A-S, U-R-E, flexion, flexural. হয়তো পড়াশোনা উচ্চারণ করতে পারে ফ্লেক্সিবল পড়াশোনা উচ্চারণ কিন্তু ইংরেজিতে আমরা ফ্লেকশন তাহলে F-A-S equal flexion means vein. It is derived from তাহলে anywhere in our body আমরা যেখানে vein দেখতে পাই most of the time আমরা এই flexion related টার্মই দিই this তাহলে flexion is bending. Extension is flexing. In the uterus, আমাদের দুটো লাইন আছে। The line about which we all are MBBS is the intrauterine line. Only in anatomy I will happen with your intrauterine line. Nowhere else. কোনো সাবজেক্টে তোমাকে হ্যামার করবে কিন্তু কলিনিউর অ্যাক্টিভিটি দিলেই ডাক্তারবাবু গাইনোকোলজিস্ট অর্থোপেডিশিয়ান সার্জন তোমাকে বলবে কত এমবিবিএসটা কি তাকি ডাক্তার হয়ে সাধারণ মানুষ মায়ের পেটে কি ছিল না ছিল মায়ের পেটে ছিল দুনিয়া ভাবার মায়ের পেটে থাকা যাচ্ছে কিন্তু তোমাকে তোমার ইন্ট্রাইট্রাইন লাইফের খবর হয় না intrauterine life in uterus. How the fetus finds? Have you seen a diagram? So many days ago, embryology was. We do not go to diagram. I follow you. Question. How the fetus finds within the uterus? language এরকম আকারই দিতে তুমিও ডিফারেন্ট নাম দাও আমিও ডিফারেন্ট নাম দিই সাইন ল্যাঙ্গুয়েজ আমি বুঝতে পারবো প্লিজ সেই ল্যাঙ্গুয়েজ কোনো কঠিন নয় আমরা কোন পশ্চাৎটা অ্যাটেন্ড করবো ভাই যে পশ্চাৎটায় আমি মাকে কষ্ট দিব আমি মায়ের পেটের ভেতরে আছি তার মানে ওই নয় যোগ আমার বাজে মায়ের কথাও ভাবতে আমি as minimum space as possible আমি এটাই হচ্ছে ফিটাসের ফিটাসের ও মাদারের ভেতরে একটা সিম্বায়োটিক রিলেশনশিপ মা তার পেটে তুমি আছো বা এ আছে বা ও আছে মার আনন্দ বাচ্চার আনন্দ যে আমি বিশ্বভুবন দেখি আপনার পর কিন্তু দেখতে গেলে মাকে কষ্ট দিলে তো হবে তাহলে as minimum space the fetus can take it will assume that সেই posture কি milking cow posture milking cow posture পশ্চাৎটা হচ্ছে এই হচ্ছে সেই পশ্চাৎ, এই হচ্ছে সেই পশ্চাৎ মিল্কিং কাউ, মিল্কিং কাউ পশ্চাৎ তুমি দেখে বলছো বাইরে তিন সরে যাচ্ছে হচ্ছে আগার থেকে, এই হচ্ছে মিল্কিং কাউ। দেখুন এই পশ্চাৎে Pressed posture. All the joints are pressed. Hip pressed, knee pressed, shoulder pressed, elbow pressed, soft pressed. তারপর এই pressed posture যখন চলে আসছে জায়গাটা কমে যাবে, এরকম দাঁড়িয়ে থাকবে না। ইনফ্রাসের মধ্যে দাঁড়িয়ে থাকলে হাত করে আরে বাবা ইনফ্লেক্টেড লাইফ করতে চলবে না, তোমার আমার ইনফ্লেক্টেড লাইফ ফেল সুন্দর ছিল বলে তুমি এই বিশ্বভূগোল দেখতে পাচ্ছ, ওর ঘরে গিয়ে আড্ডা মারতে পারছো, বুঝেছো? তাই ইনফ্লেক্টেড লাইফ করতে চলবে। তাহলে মিল্কিং কাউ পশ্চাৎ, ঠিক আছে? এই ফ্লেক্স পশ্চাৎে আমরা এইবার কথা হচ্ছে, তাহলে অ্যাক্টিভিটি টু মুভমেন্ট দেখো আমি পড়ালে শেষ করতে পারি না, হ্যাঁ আমি পড়াবো কিন্তু হবে না, তার কারণ আমি জানি তোমরা বোঝো না, প্র্যাকটিক্যালি তোমরা কোনো ইন্টারেস্টই পাচ্ছ না, দারুণ বুঝছি সেটা। তাহলে এই ঘটনা হচ্ছে ক্রিয়েট ইন্টারেস্ট, অ্যানাটমির এইসব জায়গা তো আছে, বইয়ে সব আছে, কিন্তু তোমরা তো দেখতেই পারে না। আমি যেটা তোমাদের বলছি এর উপরে থাকবে না, কারণ টেস্ট ওখানে নাটক করার জায়গা তো নয়, পিঠে দেওয়ার নাটক হবে না, পিঠের মধ্যে থেকে বেরিয়ে এলো মানুষ, আর তাও হচ্ছে এখন তো ভার্চুয়াল রিয়েলিটিতে অনেক কিছুই হচ্ছে, হ্যাঁ ওই ছবি হয়ে যাচ্ছে, নাচছে বইয়ের ডায়াগ্রাম, সেসবও অনেক হচ্ছে, আমি জানি আমি অনেক ভার্চুয়াল রিয়েলিটি। যাই হোক এইবার কথা হচ্ছে অ্যাঙ্গেলের পার্সপেক্টিভে তুমি আসো, তাহলে অ্যাঙ্গেলে আমরা বলছি ফ্লেক্সন এক্সটেনশন, অসুবিধা কিন্তু নেই, কিন্তু তুমি যখন করবে মুভমেন্ট পার্টিকেল অ্যাঙ্গেল তোমাকে এক্সামিনার জিজ্ঞেস করবে যে অ্যাঙ্গেল I think you know is a range, so you please name the movement that are being permitted in that. তুমি বলে স্যার ফ্লেক্সন এক্সটেনশন you once more but can't tell you one more বুঝলি? তারপর যখন তুমি এক্সটেনশন করবে ফটকা হয়ে যাবে, কেন? In case of foot, in case of ankle, the middle platform is at right angle, not like the hand, in alignment with the forearm. Here another question, in alignment with the forearm. In case of foot, it's like this, at right angle আছে, কিন্তু at right angle আছে, right angle আছে। তাহলে আমরা কি বললাম? Flexion extension এর definition অনুযায়ী flexion is bending, extension is straightening. But here, as I was extension, I will not see the foot is straightening. Instead, it is bending up. This is extension. This is flexion. Because this is flexion movement. This is extension. So the foot is bending. Because যেটাকে আমি ফ্লেক্সন বলছি, the foot is bending towards the ground. এটাকে এক্সটেনশন বলছি, the foot is bending, which is at right angle, anatomical position থেকে it is bending up, away from the ground, but in both the cases it is bending. Correct? How can I say the movements are flexion extension? Now in this fallacy, because of this fallacy, the muscles are named as flexion extension. In the anterior compartment of the leg, যে মাসলগুলোকে তুমি দেখো, those are extensors of the body, those are extensors of the ankle. ঠিক আছে? If you write in your answer script that the muscles in the anterior compartment of the leg are extensors of the ankle, কেউ পারবে না। But most size কি লেখা উচিত? These muscles and their tendons are dorsiflexion. That in both the cases, since there is bending of the foot, because one is towards the ground, Another is away from the ground. মানে upward movement যখন হচ্ছে তাকে আমরা বলছি dorsiflexion. Dorsiflexion is synonymous with extension. Plantarflexion is synonymous with flexion. The ankle permits not flexion extension. Flexion extension is permit করে কিন্তু নামটা permit হয় পিছিয়ে plantarflexion. ঠিক আছে তাহলে in the ankle in relation to the ankle we will be finding dorsiflexion, plantarflexion. তাহলে আমরা কি বললাম আমরা এই দুটো ট্রান্সফর্মকে করেছি আমরা ফ্লেক্সনটাকে করেছি plantarflexion আর এক্সটেনশনটাকে আমরা করেছি dorsiflexion. ঠিক আছে dorsiflexion. Now there will be dorsiflexion and plantarflexion. Which of the two movements, which one of these two movements are more free and which we need to obtain in our day-to-day life? The next question the examiner will ask. Of these two, only two movements are permitted in the ankle. Dorsiflexion, the foot is moving up. Plantarflexion, the foot is moving down. Of these two movements, which one we need more in our day-to-day life? Plantarflexion. As one begins running from walking, he has to rise up. This all these are hard moves. I mean, to say we run on our toes, we walk on our heels. This when you যখনই বেরোতে যাবে তোমাকে heel raise করতে হবে toes will be on the ground তাহলে toesটাকে যদি এই করতে হয় plantarflexion and in plantarflexion range is more range of movement আছে কিন্তু মনে রাখবে প্রত্যেকটা এই dorsiflexion আমি বলছি এই পা এই হচ্ছে dorsiflexion এর এত plantarflexion এর এত তাহলে রেঞ্জটা কত বেশি হলো এই অ্যাঙ্গেল plantarflexion এর রেঞ্জ বেশি তাহলে তুমি ফিজিক্স পড়েছো কিসের জন্য তোমরা ব্যাপারটাকে সব ভুলে যাও যখন তুমি ডাক্তারিতে আসছো না it is biology no need of physics no need of maths আরে ভাই জয়েন্ট থেকে জয়েন্ট ডাইমেনশন যদি তুমি অর্থোপেডিক্স করলে সব লাগবে তুমি যখন প্লাস্টার করবে সিম্পল জিনিস কোয়ান্টাম সলভ করে ফ্র্যাকচার হওয়ার পর প্লাস্টার করলেও তোমাকে এই জয়েন্ট মুভমেন্ট জানতে হবে ঠিক তাহলে রিমেম্বার মুভমেন্ট plantarflexion is more free ঠিক আছে and range is more in case of plantarflexion which movement we need more plantarflexion তাহলে এই প্রত্যেকটা কথা আমাকে মনে রাখতে হবে next is name the muscles which cause dorsiflexion all the muscles of the anterior compartment কি muscles আছে that are sorry all the muscles of the anterior compartment of leg crossing the ankle joint টাকে কিন্তু cross করতে হবে either from the front or from behind or from either side or from the back joint কে cross না করলে কিন্তু কোনো muscle it will fail to act as a joint আরে ও joint কে না cross করলে তুমি টানবে ডিস্টাল মুভমেন্ট টানতে গেলে তো joint কে cross করতেই হবে তুমি ম্যান্ডেটরি it is natural only dorsiflexions are tibialis anterior extensor anterior longus extensor hallucis longus peroneus maximus these are the dorsiflexions the names only are important they are not so but about the plantarflexion there are so many plantarflexions are there so many tendons are there crossing the ankle from behind all are plantarflexions besides there are other chief action which সমস্ত এর ভগবান তোমাকে বললাম এক্সটেনশন বললাম বল দ্য এক্সটেনশন ডিটোরা এই যে মাসল in the anterior compartment of the ligament এই মাসলটা প্রিন্সিপাল অ্যাকশন কার জন্য অ্যাসাইন করা আছে এই মাসলটাকে যখন নেচার ক্রিয়েট করেছে অ্যান্টিরিয়র কম্পার্টমেন্টে কেন করেছে টু মুভ দ্য টোস ঠিক আছে মাসলটাকে রেখেছে রেখে it has its action upon the distal end of the lower limb toes the extensor fibula চারটে টেন্ডনে ভাগ it will go to the lateral foretoes for extensor analysis from the straight here তাহলে এর প্রিন্সিপাল অ্যাকশন এর কিন্তু তৈরি করেছে নেচার act upon the toes these are extensors the toes but a tender the muscle থেকে like তাহলে when a muscle contract the tendon will act upon all the joints that it is. This is obvious. After tendon, এইখান থেকে এই মাসলটা এটা মাসল this is the muscle and this is the tendon. এইটা হচ্ছে তার টেন্ডন এইটা টেন্ডন এইখানে টোজ আছে এইখানে গাছ তাহলে এই যে গাছ it's soil or it's summer across the entire pedal মানে it is possible all the intertarsal joint tarsometarsal joint the metatarsophalangeal joint and then the interphalangeal joint but it will act upon all but since the tendon is causing the angle it has got no other option but dorsiflexion এবার এটাকে আমি কাউন্টার করতে পারি সব মাসল অ্যাকশন আছে মাসল ডায়নামিক্স এসব তোমার জানার দরকার নেই তোমাকে যে কথাটা বলছি এটা কিন্তু ইম্পর্টেন্ট একটা মাসল will aid the tendon and it will process so many joints it will act upon all the কিন্তু বন্ধ করে কন্ট্রোলার কোথায় ব্রেন and এই ব্রেন তোমার খবর রাখছে তুমি বসে আছো চেয়ারে চলো তুমি ছোট ট্রেনিং মোডে আছো লার্নিং মোডে আছো তোমার যখন তুমি মনে করতে পারবে 5-6 বছর বয়সে তোমার কি হয়েছে ঠিক আছে আমরা যখন ছোট থাকি লার্নিং মোডে থাকি তোমার হাত পা কিন্তু মুভ করছে কি তোমার বাবা মা দেখছে বা তুমি যখন ব্রেক স্কুলে গেছো তোমার ম্যাডামরা দেখছে মিসরা দেখছে এই বাচ্চা তুমি তুই ছোট ওটাকে মুভ করছো করছো ওপরে তো প্লিজ লেটস গো উইদাউট মুভিং হ্যান্ড বুঝেছো ইনস্ট্রাকশন দেয় তুমি বাচ্চা অবস্থায় সেটা ফলো করছো যে ফলো করেছে ব্রেন তখন কিন্তু একটা উঠবে না কারণ এখানে অ্যান্টার আছে বুঝেছো এই যে সুন্দর কাজ করে এই যে সুন্দর কোয়ান্টার আছে motor cortex cerebellum smaller brain and the basal ganglia these three units within the brain work in harmony work in tandem to produce an act this তাহলে তুমি বেসিক ফান্ডামেন্টালস না জানলে তুমি এটা জানবে কি করে ভাই সেই যে কথা এটা জানে না তারা নিজেদের কোন মনে করে বাকিদের ছাগল মনে করে নিউরোমেডিসিন যারা ডিএম করে প্রত্যেকটা অলওয়েজ মোস্ট অফ দ্য পিপল মেগালোম্যান ক্যাটাগরি যে বাকি ডাক্তার যারা আছে না ওরা যদি প্র্যাকটিস করে most of the neuromedicine physicians megalomaniac তারপর ওদের বন্ধুদেরকে দিয়ে কারবার বুঝেছো ও অনুভবের পাত্তাই দেয় দিস ইজ হিউম্যান নেচার এটা ভালো না এটা মোটেই ভালো অর্থোপেডিশিয়ান কাজ করছে তুমি প্রফেশনাল তুমি ব্রেন ম্যান তুমি ব্রেন নিয়ে কাজ করছো ভাই ওকে ডক্টর হিয়ার ট্রিটমেন্ট নিয়েছে, নদী কাঁপাবে, দিদিন কাঁপাবে, কাঁপার কোনো জায়গায় গেছে, আমি যেতে পারিনি কোনো কাঁপাতে পারছি না, ওটা কথা বুঝেছি। তাহলে যে ব্যক্তি নাড়াচাড়া করে তার রক্তচাপ অনেক বেশি, জানি এবং বাচ্চা। তাহলে আমি তোমাকে dorsiflexion বলেছি, plantarflexion অনেক আছে, all the tendons that cross the ankle from behind the plantarflexion, but to pass another takes down mind out একটা জিনিসের নাম বললে তুমি পাস করে যাবে। name the plantarflexion of the ankle, name the plantarflexion or flexures of the ankle, একটা বললেই পাস আর না বললে ফেল। তুমি হাতের কথা বলছো নো প্লিজ প্লিজ তোমার বুদ্ধি ওটা বেরোবে না। মাছের ভেতরে তোমাকে আমি পাস করতে গেলে আড়াই করতে হবে 2.5% তুমি দিয়ে রেখে বাকি সব বলবে 2.5 আর সব বললে 5/5 কিন্তু একটা না বলার জন্য ভুল হয়ে যাবে মাছের। সেই টেন্ডনটার নাম টেন্ডোক্যালকেনিয়াস or টেন্ডোক্যালকেনিয়াস, gastrocnemius soleus, common tendon, very strong, inserts in the heel bone calcaneum. সোজাটা জানতো, তোমার গল্প বলেছিল বলিনি, সোজাটা জানতো, ট্রোজান ট্রয় যুদ্ধ, এলেন অফ ট্রয়, গ্রিক এন্ড ট্রোজান, অ্যাকিলিস হেক্টরকে মেরে দিল, দেখো চোখের ছায়া নেমে এলো among the Trojans, সব থেকে বড় বীর দুয়েলে হেরে গেছে। আরেকবার পরে ওদের সঙ্গীত ফিরে এসে না ওই যে গ্রিক ওয়ারিয়ার অ্যাকিলিস ওকে মারবো না, কারণ দুয়েলে মারা গেছে হেক্টর, ট্রোজানরা দূর থেকে মারলো বীর এখানে রাজি। Throughout the rest of his life, Achilles has been like যুদ্ধে জিতেও সারা জীবন পড়া Achilles because of injury to the tendon-calcaneus, সেই জন্য তার নাম হচ্ছে Achilles tendon। Achilles tendon আর এই tendon-calcaneus হচ্ছে chief plantar flexure of the ankle muscle। তাহলে মুভমেন্ট আমি বলেছি, এইবার কথা হচ্ছে অ্যাঙ্কেল জয়েন্ট স্ট্রাকচারালি সাইলোভিয়াল জয়েন্ট, তাহলে ইট মাস্ট বি হ্যাভিং এ ক্যাপসুল পাতেই হবে। তোমার অনেকগুলো জয়েন্ট কিন্তু হয়েছে, ডক্টর প্রভাস নারায়ণ জয়েন্ট করিয়েছেন, সুব্রমণিয়াম স্যার জয়েন্ট করিয়েছেন। ক্যাপসুল কেন আছে? একটা সাইলোভিয়াল জয়েন্টে ক্যাপসুল কেন থাকে? ক্যাপসুল থাকে to enclose the joint or to shut off the joint cavity from the external. Cavity is the level. তুমি যদি বাইরের সঙ্গে কমিউনিকেট করে that cavity, তাহলে chances of infection introducing into the joint will be more. And the cavity আমরা করেছি, cavity কেন করেছি? So that the মাঝখানে space রেখেছি between the bones. কেন রেখেছি? So that the bones can freely move against one another. তাহলে cavity shut off করার জন্য একটা বল অ্যারাউন্ড আমরা একটা ক্যাপসুল দিই। ক্যাপসুলের নাম কি ডিফারেন্ট বুকস যখন জয়েন্ট করা হচ্ছে তুমি দেখবে সব বিভিন্ন রকম নাম, কোথাও লেখা আছে ক্যাপসুলার লিগামেন্ট, অথবা তাহলে এক জায়গায় অনেক জায়গায় লেখা আছে ক্যাপসুলার লিগামেন্ট, জয়েন্টের জায়গায় লেখা আছে ফাইব্রাস ক্যাপসুল। এইসব থাকে তো তুমি ইনে লস একটা লস But it is better. Capsular ligament, fibrous capsule, কোনো অসুবিধা নেই। তারপর ligament তো fibrous না। Texture, tissue wise, it is fibrous. তাহলে joint capsule কি? Joint capsule. তাহলে joint capsule এর আমরা একটা বলছি, এটা ইম্পর্টেন্ট, এটা it will help, মানে এই কথাটা তোমাকে throughout ফার্স্ট এর ক্লিয়ার লাগবে। ভীষণ ইম্পর্টেন্ট। তার কারণ অনেক সাইলোভিয়াল জয়েন্ট আমরা পড়াবো, এটা ভীষণ ইম্পর্টেন্ট হবে। synovial joint. তাহলে এটা হচ্ছে একটা পার্টিনেন্ট জিনিস অফ এ synovial ওষুধের ক্যাপসুলটাকে তুমি তো জানো ক্যাপসুল ফর্মে আছে অনেক ড্রাগস। তাহলে ক্যাপসুলটা হচ্ছে কোর শেল, তার ভিতরে অ্যাক্টিভ ইনগ্রেডিয়েন্ট থাকে, ওষুধটা থাকে, মশলা করা থাকে। সেটা কেন করা হয়েছে? ডেফিনেটলি ইট সার্ভস সাম ফাংশন in case of that drug. That in case of synovial joint, the shape is the joint capsule. That is the joint capsule is capsular ligament or fibrous capsule. Is it so or not? Fibrous capsule, capsular ligament, joint capsule. This three terms are what we call capsular ligament, fibrous capsule, joint capsule. Are these three terms synonymous or if they are different? Please explain how. Follow. খুব সামান্য কথা, কিন্তু এই সামান্য কথাটা তোমাদের জয়েন্ট হয়ে গেছে তোমরা বলতে পারছো। তার কারণ তোমরা জেনারেল অ্যানাটমি বই দিনই পড়ছো। জেনারেল অ্যানাটমি তো বেশ ভাই, ওর উপর দাঁড়িয়ে তুমি ডরসাল অ্যানাটমি তোমাকে শিখতে হবে। তো জেনারেল অ্যানাটমি না পড়লে হবে? জয়েন্ট ক্যাপসুলে দুটো কম্পোনেন্ট আছে। এই যে শেল, এই শেলটার দুটো কম্পোনেন্ট আছে। শেল inversion, shell or inversion of the joint capsule. দুটো কম্পোনেন্ট আছে। যে কম্পোনেন্টটা helps in binding the bones together along with protecting the joint capsule from the exchange, binding the bones together firmly. কারণ জয়েন্ট তো participating bones কে তো লাইন করতে হবে, তাই না? মাপতে তো হবে মাইক্রোসিস্টেম। তাহলে ক্যাপসুলার লিগামেন্ট অফ ফাইব্রাস ক্যাপসুল সাব it serves as an inversion. Moreover, it binds the bones together, which is a very important aspect of joint dynamics or joint dynamics. তোমার বন্ধুকে না করতে হবে না, বন্ধুকে বাধা থাকে বলেই তো আমরা এত সুন্দর মুভমেন্ট করতে পারছি। একটু এদিক ওদিক সরে গেলে, লিগামেন্ট ছিঁড়ে গেলে আমরা কি বলি? ডিসলোকেশন। জয়েন্টের যে আর্কিটেকচার ডিসরাপশন, সেটাকে ডাক্তার ভাষায় বলা হয় ডিসলোকেশন। তোমাকে ডাক্তার বলবে ছুটি দিতে হবে, চিকিৎসা করতে হবে, তবে তো ঠিক হবে, আবার অ্যালাইনমেন্টে আসবে। দুটো গুণের কাজ। তাহলে ক্যাপসুলার লিগামেন্ট or fibrous capsule serve that also binding the bones together plus including the capsule. ঠিক আছে? তাহলে একটা কম্পোনেন্ট হচ্ছে fibrous capsule, fibrous capsule। এটাকে আমরা অল্টারনেটিভ এই fibrous capsule কোনো জায়গায় বড় জয়েন্ট এই fibrous capsule ভীষণ স্ট্রং থাকে, সেই জন্য আমরা এটাকে অল্টারনেটিভ ক্যাপসুলার লিগামেন্ট, ঠিক আছে, ক্যাপসুলার লিগামেন্ট বলে। তাহলে ফাইব্রাস ক্যাপসুলটাকে আমরা অল্টারনেটিভ ক্যাপসুলার লিগামেন্ট, ক্যাপসুলার লিগামেন্ট। এই সেকেন্ড কম্পোনেন্ট তোমরা কেউ হ্যান্ড আউট এতদিন পর্যন্ত যে তোমাদের হচ্ছে, সুভাষ ব্যানার্জি স্যার তোমাদের অনেক স্লাইডস দেখিয়েছেন, সুব্রময় স্যার অনেক স্লাইড দেখিয়েছেন। আমি ডেফিনেটলি যে সুব্রময় স্যার স্ট্রাকচার যখন বলেছে নি জয়েন্ট, ডেফিনেটলি কথা বলেছে, ডিটেল বলা যায় নি জয়েন্ট, কিন্তু ডেফিনেটলি কি আছে আদার সুভাষ ব্যানার্জি স্যার, সুব্রময় স্যার ও বলেছে Please tell me the second component of joint capacity. You are reading your books, right? Hey, क्या बात है भाई, आपको कभी चल रहा है मित्र के सामने में बसते हो हमें स्कूल ड्राइव की जानी है तो इबार आगे तो मैं बोले दिस তাহলে আমরা জয়েন্টটাকে বলছি সাইনোভিয়াল why on we are given this mobile joint is precisely this why the synovial joints are called so this name why ये वीडियो ऑपरेटर वीडियो में this joint are being called as synovial আমার থেকে 100 গুণ বড় একটা মাপের টিচার ছিলেন আলিগড় মুসলিম ইউনিভার্সিটি আলটিমেটলি উনি ওখানকার ডিন হয়েছিলেন মেডিকেল সায়েন্স ফ্যাকাল্টি ওনার নাম হচ্ছে মাহি হাসান আলিগড় মুসলিম ইউনিভার্সিটি মাহি হাসানের ক্লাস অ্যাটেন্ড করেছে এরকম আমাদের জুনিয়র কলিগ অ্যানাটমি ডিপার্টমেন্টে আমাদের ওয়েস্ট বেঙ্গলে জয়েন করেছে তা বলছে মাহি হাসান আলিগড় মুসলিম ইউনিভার্সিটি ওখানে তো খানিকটা মুগলাই তাজিম আছে দেখ জানো মুগল তাজিম আলিগড় মুসলিম ইউনিভার্সিটি এবার স্যার জেনারেল অ্যানাটমিতে জয়েন্টস পড়াতো এবার খানিকক্ষণ ক্লাসের পর মাহি হাসান খানিক 10-15 মিনিট ক্লাস হয়েছে সাইনোভিয়াল জয়েন্ট সার্টিফিকেশন একজন আড্ডানি হলো মডার্ন আলিগড় মুসলিম ইউনিভার্সিটি সেরকম পোশাক হতে মাত্র পাজামা পাঞ্জাবি এবার সব ছাত্ররা দেখছে যে হাতে একটা সিলভারের একটা বাটি সিলভার পট ঠিক আছে আর একটা স্যার সিলভার পটটা দেখা যাচ্ছে সি দিস ইজ এমটি ম্যাটিস গেট সি দিস ইজ এমটি এবার তারপরে আপনাকে বলে প্লিজ গিভ মি দ্য এগ গিভ দ্য নেম ঠিক আছে আচ্ছা দিন 250 মার্ক সি দিস ইজ দ্য এগ you can particularly appreciate this is nothing but an egg you are ordering a bowl please make omelette egg has been transparent ভেতরে egg yolk রয়েছে silver में what ordering a bowl ordering গ্যালারিতে যে দুটো স্টুডেন্টরা বসে আছে তাদের কাছে নিয়ে গেল egg has moving synovial কথাটা অর্থ হচ্ছে it resembles the fresh egg and তাইলে যদি জয়েন্ট ক্যাভিটি ওপেন করো synovial fluid it look like egg and transparent gel like দেখো that is why these are being called as synovial. So this is how anatomy is done. এই মানুষটা হচ্ছে মাহি হাসান আমি ওর কাছ থেকে ধার করে তোমাকে বলবো আমি আমার কাছে দ্যাটস অল দ্যাটস ইট
Here are the complementary principles. Complementary medicine, what are these concepts? Basic things, very basic. Okay. Today we will discuss regarding the levels of prevention and mode of intervention. Actually, আসলে যাও দেখতে পাবো ডিস্টার্ব করো না প্লিজ so always remember though the subject is called community medicine actually previously ancient times it was called preventive medicine but community medicine principles are actually in the preventive medicine you can apply preventive principles in all aspects of our life. Even someone is suffering from disease, it will take preventive action. Okay, someone at the later stage of the summary, we can take event reaction. Throughout the mode of it, already Adam has discussed the natural history of the disease. Natural history of diseases. Therefore, the disease before the start of the disease, before the start of the symptoms, at the end, complications are there, sufferings are there. In all these areas, you can take preventive action. Okay, but that does not take that preventive action will be taken by a community medicine specialist. That will be taken under the community medicine principles by the clinicians, by physicians, by surgeons, etc. So that means the levels of prevention is in all levels of your natural history of disease. You understand the natural history of disease already taken now? What is the natural history of the disease? Pre-pathogenesis period, pathogenesis period. So throughout the natural history of the disease, throughout the life, you can take preventive action. That is levels of prevention. Now already has been taken class. You go. Probably this class also will take an epidemiology of that. Just like their definition, anybody may ask you what the epidemiology of that. That is random. So disease it has been proved now as we will discuss. Disease has been proved by combination of agent, host, and environment. That means agent factors, host factors, and environment factors. Actually, in previous days, in ancient times, so this will go on. Actually, first scientific theory in ancient times, people used to call disease is to the cause of what cause of when people are not civilized, is a cause of God or cause of Almighty. So there was no scientific theory. When the first scientific theory is how disease occurs, how illness occurs, that is called germ theory. People understood that there are some germs. That germs may be bacteria, virus, parasites, etc. And that is causing the disease. Other factors you have to know. So one scientific theory for professional disease was the germ theory. Germ means to understand germ, organisms, etc. Plenty of germs is in the environment, in the air, in the water, in the soil, etc. We are sitting here, crores and crores of germs are there around you. But nobody, all of you are not suffering from the disease. So when we suffer from disease, that is due to the action of agent, host, and environment. So what are the modern theory of causation of disease? Epidemiological tract. Epidemiological tract is agent, host, and environment. Okay. Next. Epidemiological tract means human health and disease. The result of human being may be three types of factors: agent factors, host factors, and environment. Almost all diseases in this world you can explain by this class of mind. Suppose someone has communicable disease. What is the communicable disease? Communicable disease factor. Infectious transmission. That is, the diseases caused by germs, bacteria, viruses, etc. Suppose COVID is a communicable disease. Malaria is a communicable disease. Cholera is a communicable disease. Respiratory infection, that is a communicable disease. Because it communicates from person to person. Okay, person to other, animals to human beings, etc. So, agent is a germ, but in non-communicable disease, agent may be. Which are non-communicable disease? Example: cardiovascular disease, cancer. These are very big factors nowadays, non-communicable disease. So, we does not, he is suffering from any cardiovascular disease. You will not contact the disease to me. Okay, because you cannot communicate with any number. So communicating agent is agent factors of communication is so many factors. High cholesterol, okay? High blood pressure, and other factors, all these things, atherosclerosis, that is thickening of the walls of the vessels, blood supply goes, all these things. So this is agent. Now ask host factor. Host factor myself, everyone. Everyone's host factors differs. You are getting the infection, both of you in the same environment, but someone is getting the infection or someone from the other is not, because there are some inherent host factors. Or subjective factors, genetic factors, anatomical factors, physiological factors, etc. And environment factors in this environment. In communicability is what are the environmental factors? Suppose mosquito is breeding. If breeding places are there, then this is the environmental factors. If your air is polluted, it is full of germs and all, that is environmental factors. If there is rain and so much of cold is there, you are not taking so much of protection. These are the environmental factors. Okay. So and what are the environmental factors for non-communicable diseases? Environmental factors for non-communicable diseases. That also there. If plenty of smoking materials are available, there is no ban. If plenty of drugs are available, drugs, narcotics, so you are taking all those things. If so many fast foods are available and no legislative actions is there, which is happening in our country. Okay. In other developed Western countries, there are, now it is becoming a bit popular in our country that in packaged foods, ingredients is written. How much fat is there, how much protein is there. But how much is there, whether that is actually written, that is also talked about. Because not that the regulated mechanism is not available in our country. So in the environment, so many risk factors are there, that is environment. If polluted air is there, polluted water is there, soil is polluted, you are getting infections environment is there. If your soil is contaminated with horse dung, cow dung, where ignorant bacteria is there. So someone got affected. So all the diseases we can explain due to the position of agent host and environment. Okay, so anybody may ask you that they don't know, people don't know why agent host are there. That means all these we can explain maybe communicable disease, maybe non-communicable disease by the interaction of agent factors, host factors, and environmental factors. Agent may be physical, chemical, and biological. Physical agent. Example, all we know. Is there any physical agent there? Are you feeling a bit warm? So it is not ideal. Heat is there, heat is a physical agent. Cold is a physical agent. Okay? Illumination is not problem. Illumination is a physical agent. Okay? All these physical agents are there. Chemical means if dust is there, dust contains different types of chemicals, that is chemical agents are there. Your polluted water, polluted air, fuel exhaust is there, petrol fumes are there, diesel fumes are there, that is chemical agents. And biological agents is bacteria, virus, parasites, host factors, I have already discussed, intrinsic factors, demographic factors, psychological factors. Intrinsic is into body. Demographic factors means, this demography also. People living in a crowded areas. Nowadays, in this world, we are living in so many, almost all of us living in the different flats, multi-stories of flats. WHO called these are actually high slums. These are slums. Okay. Actually, there are who are in the social group, the hosties slums, but these are also a bit of slums. Because people living in crowded conditions, so many are there, social environment is there. That much of legislation is not there, they are not there, so they would have factors. Psychosocial factors, these other factors in the family, in the society, in people are not happy, I mean, they are not getting the partner relationships, mother, broken families, etc. So many, but it affects your host, affects the body. And environmental factors. That is environment also, physical environment, biological environment, but those elements are there. Those elements are there. Environment, physical environment, air, water, soil, these are physical environment. Biological is something, the environment also is and those elements are there. But if the environment remains fixed, environment is modified, those elements will not be there. So environment factors are and social factors are so everybody does that. Next. Now there are some terms you should understand in common medicine. People may take, our faculties may take different types of topics, but I always say you remember the basic things. Because in your later days, you will learn suppose National Malaria Control Program, National Anemia Control Program, or National Eradication Program. So what do you mean by this? What do you mean by control? Control means diseases continue to persist and is transmitted at a low level, so that particular person is not particle. Control, disease is there, but at a low level. So the disease in the body is a particle problem. Presently, you know, example, at present, COVID is still there. COVID virus is still there. But it is not in that amount that it is controlled, it is affecting, it is not a partition problem for the country. So lockdown is not there. We are going outside, we are traveling, we are assisting our normal duties, offices, etc. So control means, when control is there, disease has been made there, but not for this. It may be applicable to non-communicable disease also. Maybe a bit of foods and other things are available, but that may not be a landmark and all. Okay. Now, maybe nowadays, those unhealthy foods may be in the 5-star hotel, maybe at the footpath also. Okay. So we may not have that much of regulation that it is available in the only footpath made foods, but in the hotels and all those things, 5-star hotels, it is regulated and all those things. But that is not there. So that means control also can be done both hospital and okay, control you understand? Resentment is there, but at a very low level. Eradication means total stoppage of transmission by complete extermination of the infected. You know it? Examples of eradication of diseases in this country. Polio, very good. Polio eradicated. Okay? Any other? Smallpox is eradicated. Okay? So these are the things. Nowadays, probably it is not attached to that. You do not use the house that probably is eradicated. We are trying to eradicate leprosy also. What it may be achieved. Okay? That is stopping of transmission. There is no stopping of transmission. Okay? But whether it is there, it is there. It is in the lab. Suppose smallpox virus is available in the lab. Okay? Or polio is available in the lab. So for research work of an army, it is available. But it has been declared by WHO and our country. It has been declared. Polio, smallpox. Elimination. Actually, another term is there, not that much used, but nowadays used. It is elimination. It is between control and elimination. Okay, that means reduction of case transmission to the determined low level. We cannot say that our target, our ministry, our government, or our officers and experts cannot say we will not eradicate the disease. Even it is very difficult also to control this. Then we may say, yes, the disease may stay there at 10%. Or disease may stay there at 20%. That is disease eliminated. It is in between a concept between control and eradication. Purification, no stoppage, complete stoppage of transmission, controls, not stoppage of transmission, transmission is there, but this is not happening. And elimination means we have targeted that we maintain a level in the society, in the community, everybody. That is it. And another is extinction. Extinction means, it is our goal. Always remember, human civilization has some goal is there. Okay, that they always try to achieve it. Maybe achieve, may not be achieved, but people are always trying. Human civilization or extinction means specific infection is not exist other in the nature of that. Okay, we say that even HIV virus, what are the extinction? Primary source of HIV virus or even COVID virus from animals. So, HIV, marking how to suffer from this. Actually, it is said that so many diseases in the dense forest like Amazon, etc. But we are entering Amazon, we are cutting trees. So, we are getting infections about this. So many diseases. It is called, it is the effect of our action. Human beings are doing, experimenting for economic purpose. They are destructive environment, they are destructive forest. So many diseases elevated in the forest, in the plants, and also in the among the animals. So we are getting the disease. So extinction means there may not be HIV virus or COVID virus in the animals and not in the laboratory. So that means extinction. Now this is not meaning. So many will remember that this is controlled and eradicated. Right? Now comes the levels of division. So we understand the natural history of disease and all those things. So if anybody asks you now simple that what is the goal of health? What is the goal of medical science? Goal of medical science. Our goal in medical science is to promote health, to restore health, okay, to preserve health, and to prevent suffering and all those things. It is not anything for common people wants that we promote our health will be promoted, we will preserve our health. Otherwise, I is not clinically healthy. I want to get preserved. And we will restore health. Restore health means I probably suffered from some disease. I probably suffered from my ear. Now I will restore it. Okay? And ultimately, we get our sufferings and diseases and also. So on the basis of this, considering the natural history of the disease, starting from risk factors up to the complications and etc., natural history of the disease and the levels of prevention. Actually, there are mainly called 3 levels of prevention. Primary prevention. Okay? Primary prevention is improving the overall health of the population by intervening before the health takes over. Those who attended the classes, you probably remember natural history of the disease, pre-pathogenesis period. Pre-pathogenesis period is the other factors are there, all those things they are, but we are not suffering. Pre-pathogenesis, okay. Symptom is not there, sign is not there, disease is not there. So pre-pathology and not started. But the difference between physiology and pathology? Common sense. Now physiology class. Physiology is the normal function going on, cell function going on. Normal function. Here you are taking food, it is digested, it is absorbed, it is metabolized, it is excreted, etc. All those things. It is a normal function. So normal function of human being is pathology. Suppose normal function of cell. Okay. When a particular normal function of cell or tissue is damaged, then pathology starts. So physiology may come into pathology. As far as according to our course of the disease process, natural history. So pre-pathogenesis period is no symptoms or signs are already there. Ultimately, diagnosis period is already summer starts. Okay, symptoms start, signs start, the diagnosis will be there. So, primary prevention is you have to take some action where diagnosis period does not occur. That is symptoms of signs does not occur. That is primary prevention. Overall health of the population is a very before the health level stop. Examples, how do we do it? That is preventing is that are taken before the pathological process has started. That means pathological process you will prevent disease. So how can you do it? You can do it by health promotion. Health promotion means steps that results that undertake to improve the general development. Principles are there. You can take action. Everybody, the whole medical science can take action so that we will help promotion. Starting from the part of examples, part. Suppose a baby is born, ideal heart rate, not low heart rate. Okay? And that baby is given proper and now to take exclusive breastfeeding, not a drop of water. So he grows healthy. These are health promotion results. In appropriate time, you add complementary foods, called complementary foods. At the Mugavan is actually at that time breast milk is not enough. Now it is said that a normal female during the lactation period, lactation you understand? Lactation is breastfeeding time. So during the lactation period, up to 5 or 6 months after the birth, the baby adequate milk secretion required for the baby. So baby is growing. Baby is at around 5 or 6 months, the baby doubles the heart rate. Almost doubles the heart rate. If 3 kg during birth, so around 6 kg and around 5 or 6 months also. So we got around 5 or 6 months, we have to start to extra food without stopping breastfeeding. Actually, so many rituals in our community, in our system is there, but at that time we were not knowing the scientific basis. So Mugavan is actually it is not a religious ritual. It is actually a ritual required for life. So at that time, enough breastfeeding is not there. You have to add extra food. Smashed potato, smashed banana, smashed rice, dal, pulses, and slowly adding protein foods, fish, egg, etc. So if you maintain that, these are health promoting results. Health promotion. Okay. Even if you give nutrient interventions, if you take proper nutrition, balance diet, that is health promoting results. If you promote to take safe drinking water, not healthy drinking water, this is potable water. Potable. Or remember not potable. P-O-T-A. Potable drinking water is not potable. You are potable means 100% safe drinking water, which is scientific for potable water. Okay? So that is the you can do primary prevention so that disease cannot occur by specific protection. Specific protection means leaders initiate some particular disease you can take to disease action. Or particular disease not to occur. Specific. Example? So many examples. Specific protection. That is the word that plenty of diseases you can protect. By immunization. Immunization, vaccination, plenty of diseases you can prevent. Since after the birth, BCG vaccination, polio vaccination, diphtheria vaccination, RTC vaccination, tetanus vaccination, hepatitis B vaccination, measles vaccination. Now in the schools and other things going on, measles and rubella vaccination. All those things, if you take properly, you are not suffering. Okay? In vaccination, there is one term called natural vaccination. Probably all of you are through newspapers during COVID. if someone is suffering from COVID, so COVID means virus means antigen. So when it enters, our body fights and antibody is prepared. Antibody is there in our body. So some natural protective for subsequent infection. Right? So natural vaccines they are there, but we are also doing intervention vaccination, not like this. Artificial doing and all those things doing, like scientific doing, even vaccination. You can give specific nutrients so that some diseases may not occur. Okay, you can ask keratin type of food. Which foods contain mainly keratin or vitamin A? Those which are yellowish fruits. Now, mango, papaya, ripe papaya, etc. all those things. Those contain others also there. So, all these things we can ask the people to take green vegetables. It is very important to take. Foreign countries, from our country, I don't know the connotation, so, they buy from our country and that is available in northern market, here market, but we don't take. Okay? It is ignorance. So, very soon. The immediate people like me, but that vegetable that is much more important than the whole way. So this is important. Green vegetables contains plenty of iron and plenty of different vitamin C, vitamin A, etc. You see here cauliflower. Cauliflower is full cooking. We will be astonished to know that our doctors also don't know the leaves of cauliflower, the highest source of iron. But in our country, our ladies, our mothers, anemia is very important, especially among females and other children. কিন্তু আমরা বাড়িতে আমি খেয়ে রেখেছি কচি ফুলকপি পাতাগুলো সেটা ভালো ভাজা ভাজা করে আমরা খেলাম, বাট we discard the food কোনো হবে না। So these are the things. These are the principles of actual farming. India is one of the richest countries in natural resources, but India is not possible. You know our influence. So that is specific protection, specific. All these things are there. If you are in an occupational environment where hazards are there, they can take preventive action. So that is specific protection. Next comes secondary prevention. Secondary prevention is disease started. Just disease started, but you can take preventive action. That is measures taken at the stage of early practice. That is at the stage of asymptomatic phase. If you take action, asymptomatic, not that much of symptoms there, so you can take action and the disease may not spread and it does not cause any harm or severity. That can be done by early diagnosis. You may call some disease. Why are you teaching me, discussing? It is the clinical. So, community medicine principles in clinical medicine may be taught. The surgery may be applied. You have to apply the disease as early as possible. As early as possible. So, that much of scientific diagnostic facilities are now there. You have to apply your knowledge. You can argue that. You will. I have also discussed you. Main example is there. Someone in some of the cancers, you can early diagnose cancer is 100%. Suppose breast cancer. So if your lung is there, all those things is there. If you do that, if it is called fine needle aspiration biopsy, then you see the malignant cell, you do the radical mastectomy 100%. 100% you will do. Because cancer did not spread to other organs. When it spreads, cancer is for it is a primary source and it spreads other. From here, it may spread brain, it may spread lungs, it may spread liver, etc. So if the base is primary source, I can remove or I can treat, I can manage. So this is there for all that is secondary level of prevention. So secondary level of prevention, so that is the main principles in communication also. And in these principles actually our healthcare delivery system is made. Health centers are there. Some of you visited the health centers. Health centers having all those early primary prevention and secondary prevention, early diagnosis, and they refer it to the secondary level. Secondary level is district hospitals or tertiary levels and medical colleges, etc. hospitals, big hospitals. So for this reason, after passing MBBS, it is called first posting in the health centers. Yes, health centers do early. Most of the diseases in our country, অনেকে বলে না যে ডাক্তারি পাস করছিস না খেয়ে বলবি না, কারণ কমন ডিজিজেস এর মাছ কম। What's are doing? Common knowledge. They know anybody suffering from cough and cold, fever, they give antibiotics and that's double tablets, etc. and everything. So we are in touch because the complicated diseases, other diseases is much less complicated than all this. But we are suffering, we are dying due to maybe suppose 10 or 20% of those cases. Okay? In the outdoor you see so many diseases that are early diagnosed. So if you can early diagnose and do the treatment and management, it may not turn into severe complications in your time. It is strange to know in these type of developing countries like us, during childbirth, our women are dying. Pregnancy is a disease. Pregnancy is a disease. What is this? Nature, that is physiology. Pregnancy is physiology of phenomenon. So if physiological phenomenon is there, why women are dying? Western countries को माना जाता है साइंस के आवाज़ है Is there a difference between American pregnancy and Indian pregnancy? No. So due to ignorance, due to less intervention, we are dying. So if you take proper action throughout this antenatal pills during anti, A-N-T-E, not A-N-T-I. Anti means against. A-N-T means anti. During natal means difficult. So if you take proper actions, health promotion and promotion specific protection and early diagnosis actions so that they don't suffer during all those things. They will gain during delivery proper action. Nobody will die. That might happen. So for this reason nowadays it is decreasing no doubt in India also due to the government action. Nowadays it is called that all pregnancy delivery should be held at institutions. That is at the center, not at home. Delivery should be at the institution. Institution means maybe health center. You are having some center. We are having health center. Maybe you get hospitals and things for this, repair centers, but they are scientific similar. Okay? Our nurses are there, our doctors are there, and so, early diagnosis. Tertiary prevention is improving the treatment and recovery. Disease is already progressing. So you can take research and the control or maintenance of disease so that suffering becomes less. Okay? That can be done. Number tertiary prevention can be like disability institutions. You can limit your disabilities, so you can maintain actions, other protective actions, nutritive actions, and all these things, so that disability does not take place. Okay. Someone suffering from cerebral stroke. Okay, cerebral stroke may be cerebral stroke occurs maybe due to high blood pressure and all those things. Okay, there is a rupture in the brain or some embolus or thrombosis is there, so blocking some area and cerebral stroke develops. So we can argue that properly treatment so that result will be less. The person may not suffer from paralysis, may not be bedridden. আমাদের পার্টনার অনেকেই আছে বয়স্ক মানুষ, আমরা আগে থেকে দেখি, আগে ডায়াগনোসিস করতে পারি, ফ্রিকোয়েন্ট ব্লাড প্রেশার চেক করি, এটা ক্লিয়ার ঠিক আছে, হ্যাঁ ব্লাড প্রেশার কন্ট্রোল হয়, ভেরি ভেরি রং। আমার ব্লাড প্রেশারটা না ওঠানামা করে, কন্ট্রোল করতে পারে, কিন্তু টেক প্রিপারেশন সায়েন্স ইজ দেয়ার, সায়েন্স কখন ভুল হয়, দিস ইজ দ্য প্রবলেম দরকার, ইভেন ইন এডুকেটেড সোসাইটি। এই নিয়মিত ব্লাড প্রেশার ওষুধ খাবো বলতে হবে না, আরে না খেলেই ক্ষতি হবে, এটা ক্ষতি হবে, ডায়াবেটিস ওষুধ নিয়মিত খাবো, হ্যাঁ ধীরে ধীরে আমার আমি হ্যাবিচুয়েটেড হয়ে যাবো, আর না খেলেই ক্ষতি করবো, ব্লাড বাড়বে। So if you maintain your blood sugar level, if you maintain your blood pressure level at normal level, your lifespan is normal, just like other individuals say, no problem. But we are not taking on this. Because we cannot make our people aware. So people get aware, that is our fault. There are fault আছে, আমি যদি aware person নাম চাওয়া, and nobody, everybody is very busy in this world nowadays. The patient is coming to the doctor, might take minutes prescription হয়ে যাচ্ছে, আমি 1000 টাকা কমিয়ে দিই। Very very wrong. We are discussing with the patient, they are not taking the history, his lifestyle, his dietary habits, etc., etc., and other family members give history and not taking action. What is the problem? So, we are very fantastic. Next is then maybe some types of disease processing that complications arise. I told you the paralysis is there. When paralysis is there, you can give some types of physical rehabilitation measures, some protective equipment, or some vocational rehabilitation measures, medical rehabilitation measures, psychosocial rehabilitation measures. That is possible. People living in with some disability at home and all those things. You can make them happy by using or by discussing or all those things. So many rehabilitation measures there. So actually it is not only the action by ourselves, by medical people, by health people, it is also the other action. Okay? So these are the main primary levels of prevention. Actually the levels of prevention that can be dynamic. So if everybody has to what are the different levels of prevention? Sir, some prevention আছে আমি বলছি যেটা if you don't say that no problem is there. At least 3 you have to say. Primary prevention, secondary prevention, and tertiary prevention. This is the principle. How can you make it? That is the mode of intervention. Next. And follow. What are you doing now? So, actually, I told you primary prevention. So the actions taken in primary prevention, actions taken in secondary prevention, actions are taken in tertiary prevention. That is the mode of intervention. Intervention to understand intervention. Intervention means you are doing something. You are regulating. That is mode of intervention. You are giving injection. That is mode of intervention. You are prescribing or giving advice. That is also mode of intervention. Okay. So mode of intervention in natural history of the disease. So this both primary, secondary, and tertiary is called. There may be not where it is nowadays this concept is coming. The purest sense of prevention is primordial prevention. Primary prevention is we call risk factors. Mainly used in non-communicable disease, but job also risk factor. So if you prevent these factors, not to in the environment, by health education to the individual, health education to the people, mass education and all these things. So if you can prevent so many diseases like obesity, overweight, etc. So if we can educate our children to remain healthy, to take balanced diet, not to take that are smoking, not to take junk foods, do day-to-day exercise, then he or she will not suffer from obese or overweight. That means primordial prevention means through individual and mass education, you can prevent that risk factors does not affect you. Risk factors do not affect you. So many risk factors are there. Many the comorbidities and non-comorbidities. Comorbidities cannot relate to the mass, to the other. So use of mask is very, very important. That is primary prevention. You are preventing risk factors that lung, cough, bacterial, droplet infection from other bodies or polluted bacterial system. Health promotion, I always tell you, health promotion, by health education, that is promotion, health promotion, next. Nutrition education and convention. Very, very important in our country, but we are not educating our people for nutrition. As I am giving examples of mulo, etc., green leafy vegetables, sharp, etc., all these things. That is how we don't have that much. It is not taught in our school levels, maybe taught. In this country, the problem is maybe long time, ancient times, it was not there. The worst is primary education is not proper in this country. That is the problem. Nowadays, those in engineering service, they give much more preference to higher secondary and secondary marks than BTech and MTech. BTech and MTech they give much more importance in your board examination results. Because in schools and other things, they learn is there. That is not proper or adequate in our class. That is the problem. And so, West Bengal is actually much more going on. That is the problem. Because a medical science cannot harm you, health education, give you nutrition, education, all these things. What the importance of teaching how to develop your plants and etc. in your home, you place it there. And you take proper nutritive foods that I have given you examples, plenty of examples are there, cauliflowers and kind of things. Everything is there in the society. But problem is, we go to the advertisement. I'm going to advertisement is contrast. Complaint rate is long. So complaint is আমাদের ফ্যামিলিতে কিন্তু তোমার বাবা তোমাদেরকে ছোটবেলায় অ্যাডভাইস দিয়েছে কেন অ্যাডভাইস করতে তারপরে ইনকাম ছিল বাবা মা ইজ দ্য প্রবলেম ওকে দ্যাট আর্টিফিশিয়াল আপনি তো বহুত করে বলছে আমেরিকানরা আগে তো পিলস খেত ছোটবেলা ব্রেকফাস্ট ফর পিলস দ্যাট ইজ মার্কেটেড মেডিসিন আপনি তো বাবা বলেছে আমেরিকান পিপল ডোন্ট টেক ভিটামিন ফ্রম দ্য পিলস take vitamin and minerals from the natural source. তুমি একটা fruits and vegetables খেলে যে পাবে তো আমরা ক্যালসিয়াম ট্যাবলেট খাই you know and the women after menopause they suffer some osteoporosis due to the lack of calcium. We take calcium tablet absorb হচ্ছে ট্যাবলেট খেলে 20% কিন্তু আমরা বাড়িতে তো বই খাই there are products contain plenty of calcium. We don't know most of us don't know. দুবেলা দই খাও ক্যালসিয়ামের অভাব আর তুমি জানো না কি ক্যালসিয়াম খাচ্ছ বিকজ when our doctors medical representatives that কি একটা মাথা অন্ডার পার্সেন্ট হচ্ছে আই আদার দিদি সালমান খান হচ্ছে আমাদের মাথা সমুদ্র আমরা ওগুলো দেখে ভাবি দিস আর দ্য আইডিয়া ফর আস idea for that is everything okay environmental modification modify environment so that pollution and other things are not there that model lifestyle and behavior changes so these are model so health promotion model intervention can be done in health education nutrition all those specific so primordial prevention health promotion specific prevention you can do it at pre-bacterial so this is not occur. Next, early diagnosis and treatment. There is more some intervention I already discussed. Next, Disability education, that is the respiratory education. So that means primary level, secondary level and tertiary level, these are the principles. And those can be achieved by this modes of intervention. What you can do, what we can do, what our clinical leaders can do, our teachers can do. Teachers are the primary level teachers, secondary level teachers, but they will do. मतलब तो अलग होम साइंस बोल भी बना I don't know whether these are not proper. These are things that are so these can always done. Regulation I already discussed. So today I discussed that legal supplementation is the main basis of community medicine to take action. So through a healthcare delivery system, through health centers, through subdivisional or multi-specialty or district hospitals, through medical colleges, these modes of intervention should be followed properly. Then we can achieve our health. We can promote health, we can preserve health, we can restore health, and we will prevent or reduce harm. Okay, thank you.
We have started with clinical physiology. Okay, so the first topic was examination of arterial pulse, then examination of blood pressure, history taking, and general examination. Up to this is done. Now we will come to systemic examination. And except clinical physiology, after clinical physiology, there is hematology, that is experiments with blood, amphibian experiments, and a few other topics, which we will have to cover in the whole year. Out of this, only clinical physiology will take 3 or 4 months, 3.5 months to be done properly. Now, the aim of doing it properly is learning properly. So for that, the effort from our side is to arrange the classes in a schedule, and the effort from your side is to attend the classes. This is simple. Knowledge respiratory system we can take one day, demonstrate for few minutes, 30 minutes briefing, 20-30 minutes briefing, demonstrating for 30 minutes, respiratory system is over and you will face the exam. This can be done, but we are keeping a revision for your batch, for this group C, we are keeping revision on Saturday for the same topic. This is because to learn it well, because without performing yourselves, performing here in front of the teachers, correcting, rectifying any mistakes, clinical examination, it is not possible to, that means it is to learn everything in one day. You have to practice. Now you have to practice among yourselves, in your hostels, wherever you live. There is a purpose of group study in medical education, especially in the clinical examination part. You have to practice among yourselves. Everything is not possible to do alone. So all these are to be done, to learn properly. Otherwise, there will be mistakes in the gross mistakes, very serious mistakes during the, like not taking consent. This is a serious mistake. You cannot straight away grab your patient, grab your subject and start doing a clinical examination. You have to make the subject comfortable. Okay. What are the general criteria of any physical examination, clinical examination? That the subject has come to the clinician's chamber or in the outpatient settings or in the inpatient settings, in the wards, medical wards. But what are the general criteria? So everybody is late because of this attendance. Those who are late, take one piece of paper. So we are repeating it, otherwise we can do one day just briefing for 30 minutes. So syllabus is completed. In 1.5 months this human will be completed, then hematology will take another 1.5 months. In 4 months the syllabus can be completed. But to do it properly it will take time. But if you don't attend, this is very disturbing also. After starting the class, so many people are coming. So I talk to the teachers will talk to the academic coordinator about this. You have a physiology exam today, 3 to 4 p.m. and 2 to 3 p.m. 8 to 3 p.m. You are updated about the schedule beforehand. Sometimes it is not possible to update because the teachers, individual teachers, they have the respiratory system. So we have done examination of arterial pulse, blood pressure, history taking, general examination. Now general examination we have done. For beginners I had told we should divide it in some points for our learning convenience as beginners. What are the points? Just quick revision. What are the points in general physical examination? If you have noted it down, you may see at least your notebook can say. Otherwise, just revise the points. General appearance, including build and nutrition. Then pulse, blood pressure, temperature. Next five together: pallor, cyanosis, jaundice, clubbing, edema. And last two are neck veins and leg glands. Grossly, some of pulse, blood pressure, temperature. Some of us are adding respiratory rate, also respiratory rate and breathing in general examination also. So when we will become professional doctors, then we will do general examination and system examination one after another, and we can overlap as per our convenience. When we are asking the subject to put the tongue, we will look for pallor, we will look for jaundice underneath the tongue, and we will also look for tongue movements, motor movements of the tongue, part of the nervous system examination. Together we will do it. But for learning purpose, we have to go step by step. So these were the points under which general physical examination was done. But it can also be done under 4 broad headings. Which are the 4 broad headings for all physical examinations, general as well as system. You can open the window just for some. Inspection means only see, to look at. Now, so in the inspection part of any physical examination, the clinician is not touching or feeling the patient with his own hand, and palpation is touching and feeling the patient with the examiner's own hand. Okay, examiner means clinicians. Here, examiner is clinician. So better we use the term clinician to avoid any doubts. Percussion is some special type of examination, clinical examination, which will come to learn what to do in percussion, and auscultation is using the stethoscope for clinical examination. So under these 4 broad headings, all systems are examined. Be it the respiratory system, be it the cardiovascular system, be it the GI system, be it the nervous system, wherever applicable nervous system, usually stethoscope is not needed, so auscultation is not there. Okay. Can we measure artery? Can we evaluate arterial pulse without just by inspection? No. So palpation is required. That means touching and feeling the subject's body by the clinician. So complete. All those who are late, roll numbers are complete. Or anybody left? Just write your roll numbers. Okay. So now what to see? What to see? Inspection of shape, size and symmetry of the chest, respiratory rate and breathing, any obvious skin changes, scar mark, pigmentation, etc. And position of trachea and apex beat. Why I write apex beat in brackets? In the first bracket I am telling, but these are the points to note in inspection. That is, inspection is without touching and feeling the subject by the examiner's clinicians himself. The clinician is not just by looking at. So what are the criteria of a general examination? The room should be, and these should be always nothing difficult in them, but these should be remembered. This must be remembered. The room must be well lighted. Okay. we have to make the subject comfortable and take his or her consent. The clinician has to make the subject comfortable and take his or her consent. If the subject is of the opposite gender as that of the clinician, then there must be an attendant just for making the subject comfortable. There must be an attendant of the same gender as that of the, of course, subject, not clinician, subject. So male clinician examine a female subject, there should be a female attendant. Female clinician examine a male subject, there has to be a male attendant. And the clinician must stand on the right hand side and proper exposure has to be done. These 5 points must be remembered. So in case of respiratory system, what is proper exposure? From whole of the neck to the waist. From the neck to the waist. Okay? Not just the chest wall, even the abdomen. Because respiratory movements will occur in the abdomen also. In fact, most respiratory movements are weird. But that means the human adults are performing. The respiratory type is abdominal respiration. Thoracic respiration is noted in sometimes, like during pregnancy. The respiration mainly becomes thoracic, sometimes in children. But in most cases, respiration is normal is abdominal. We will note the respiratory rate and breathing mostly by the abdominal movements. Now, so proper exposure is to be done. So proper exposure is to be done. Okay. So shape, size, and symmetry. So normally, what is the shape and shape of the chest? Is the transverse diameter more or the anterior posterior diameter? Obviously, just by common sense, transverse diameter is more. Usually, it's 7:5. That is theoretical. This is theoretical. It's usually 7:5. But sometimes the chest becomes rounded, barrel-shaped chest. Okay, in some obstructive lung diseases, or there are various types of abnormal chest shapes described. Pigeon-shaped chest in rickets. Rickets is a disease of deficiency of vitamin D in children. Okay, so pigeon-shaped chest. Kyphosis. What is kyphosis? What is scoliosis? Nothing to write. Everything is given in all standard practical books. Scoliosis is lateral bending of the vertebral column. Then the chest shape of the chest is deformed. The forward bending of the vertebral column, that is forward it becomes concave. Actually it should be said backward bending. That means concavity forward, convexity backward. That is kyphosis and lordosis. These are some abnormal changes in the vertebral column. Lordosis. That is the convexity is forwards of the vertebral column. These affects the shape of the chest as well. So, gross changes, obvious changes in shape, size and symmetry of the chest. One side deviation of the whole, the internal organs, the chest wall. One side deviation. It is looking that the chest wall is deformed and shifted to one side. If this is obvious or just on exposure, proper exposure means neck to waist, all clothing have to be put off and you have to examine the subject. Inspection, shape, size and symmetry. Respiratory rate and reading. How do we measure respiratory rate? Putting our hand as we do during arterial pulse examination. Why we put our hand, but this is not palpation because we are not examining the pulse. So why do we during respiratory rate measurement the clinician puts his or her hand on the pulse of the subject just to avoid the subject being aware that respiratory rate is being measured. Can you understand this? Because if the subject is aware that respiratory rate is being measured, he or she may become anxious and the respiratory rate may increase. So to avoid that, the clinician is acting as if the pulse is being measured. But actually, the clinician is taking note of the respiratory rate and together simultaneously the breathing, whether it is regular breathing pattern or irregular breathing pattern. Okay, next is any obvious skin changes. We expose and find any scar mark, any pigmentation. We ask the subject, how did this occur? Was it because of any surgical intervention, any operation, any operative procedure, or is it by birth, etc. So this is one thing to note on just by inspection. We are not having to. See, in respiratory rate examination, we are holding the pulse, but we are not bringing it under palpation, because nothing of the respiratory system requires palpation here. That is just to act. So this is by inspection. Scar mark, any skin changes is by inspection. And position of the trachea. Trachea is central in position just by looking at if there is not any obvious serious, not serious, any gross deviation is not there, difficult to pick up by inspection alone, but if there is gross deviation shifted to right side or left side very prominently, we can pick it up just by inspection. Now apex beat is the cardiac pulsation, prominent cardiac pulsation at the apex of the heart. You will read it in theory as well, and we will do it in cardiovascular practical. When you do cardiovascular practical portion, we will do it. So during exposure of the chest, during noting down the respiratory abnormalities, if any, then we also note the apex beat. But for now, we are leaving it. We will do it in the cardiovascular system examination. I think apex beat one separate class may be taken. So that will come later, but this also comes under inspection of the respiratory system. So position of trachea and apex beat. So these are the points to note in inspection. Now see what is to be remembered in inspection. So during inspection, we are not, the clinician is not touching or feeling the patient at all. Only during respiratory rate examination, we are holding the pulse just for convenience, so that the subject does not get aware of that the respiratory rate is being measured and does not get answers. That is the only purpose. That is not palpation, that is inspection. In palpation, again, what is being done? Shape and symmetry of the chest wall. If any gross deviation is there, it will be picked up by inspection, as we told. And this will be confirmed by palpation. How we will learn? During demonstration. Shape and symmetry. Again, position of trachea as well as apex beat. As before, apex beat we will do it maybe as a separate class with CVS, cardiovascular system, position of trachea and apex beat. And one thing which is not possible by inspection, this has to be done by palpation. That one point is vocal femidus. Now, how to do shape and symmetry? We will show during demonstration, and then practice. You have to practice yourselves. We support the chest wall of the proper exposure is already done. No need, nothing to repeat. So we support the chest wall with 4 fingers except the thumb. Lateral chest walls, like this, of the subject. Lateral chest wall. We are standing in front. If the clinician is right-handed, the clinician is standing more or less towards the right side, or in this case for convenience, we may come directly in front of the subject. We support the lateral chest walls, so there is to restrict any obvious movements of lateral chest wall, and put the thumbs oppose our own thumbs, the clinician's thumbs in the middle of the chest wall, in the midline. And this is done towards the lower end of the chest to gauge the expansion of the chest wall during breathing movements. So what will happen if symmetry is as it is functional normal symmetry? What will happen? As soon as the chest wall expands during inspiration, the thumbs will move. Thumbs should move, not this much, at least a little it will move, but the movement will be equal on both sides. If not equal on both sides, then there is some asymmetry. Now, if there is very mild asymmetry, say more expansion on one side or less expansion on one side, then that cannot be picked up by inspection. It is not possible. So then it is picked up by palpation. And if there is gross asymmetry, then very large asymmetry, then very high degree of asymmetry, then it is obviously visible on inspection as well as it is confirmed by palpation. So this is shape and symmetry of the chest. Either inspectory findings are confirmed, or if mild asymmetry, then mild change in shape may be picked up by palpation. Now, position of trachea. If there is obvious deviation of the trachea to any one side, then that is picked up by inspection. Now we will put our 2 fingers on the 2 sides of the trachea. Some books are writing 2 fingers, or we may put also 1 finger just to locate its central. If there is a mild deviation, then on inspection it is appearing more or less central. But on holding it, we may find that there is some deviation to one side. When you bring the finger like this over the subject's trachea, like this, from above to below, we may note the deviation. Now putting two fingers, the advantage is, see, just rotate, all of you rotate your heads to any one side, say to the left side. Then see, if you have rotated it to the left side, then the right side one muscle is prominent here. If you have rotated it to the left side, that is the one head of the sternocleidomastoid. You rotate it to the right side, the left head is prominent. You rotate it to the left side, the right head is prominent. Now between the trachea and these sternocleidomastoid heads, there is a gap. So this gap will also be shifted if the trachea is shifted. That means the gap will change in position. That is the advantage of putting two fingers. So you may do it with one finger, as written in process is not wrong, but if you put two fingers, it is more easier to pick up, I think. So this is how to note the position. And now if there is mild deviation, you may have to pick it up by palpation only. You cannot pick it up, we cannot pick it up by inspection alone. So shape, position of trachea, apex bit, how we do it, we will come to it in the next classes. And vocal fremitus. What is vocal fremitus? Wherever we use the term vocal, particularly during respiratory system examination, vocal means the subject is speaking something. Now what is vocal fremitus? That is, whenever we are speaking, vibrations are being set up in the chest wall. Either they can be picked up by the stethoscope. So when they are picked up by the stethoscope, that is called vocal resonance, not fremitus. And these vibrations in the chest wall which are being produced can be either picked up by the stethoscope, then it is called vocal resonance, RESONANC. But it can even be picked up by the clinician's hand itself. When stethoscope was not invented, even the vibrations could be picked up by the clinician's hand itself. Now how to pick up these vibrations? So for that we must learn how to locate the intercostal spaces. Intercostal spaces means spaces between the ribs. Now directly over any bone, it is difficult to pick up these vibrations, directly over the bone. So we have to find the intercostal spaces. How do we find the intercostal spaces? See, now again see, below the trachea, here there is a notch. This is called jugular notch. You will learn better than me when you complete your thorax. Now you are possibly doing inferior extremity or superior extremity in your anatomy classes. Whenever you will be doing the thorax, you will come to know this. You have to read about the sternal bone, clavicle, sternal bone, okay, sternum. So this is the sternal notch. So more or less parallel means to the sides, on both sides are the second ribs. Exactly not at the sternal or jugular notch, just below it there is one thing called the sternal angle, part of the sternum bone. Lateral to the sternal angles on both sides are the second ribs. So the rib you find just going lateral to it is the second rib. Now below the second rib is second intercostal space. There are 12 ribs, and so corresponding how many intercostal spaces? 11. Below first rib is first space, below second rib is second space, below third rib is third space, and so on. So second intercostal space you have to locate. And now the clinician has to put his or her medial border of this own hand. Which part of the superior extremity is called the hand? Medically, part below the wrist joint. That means you should not say it below, you should say it in medical terms now. That is part distal to the wrist joint. Proximal is towards the axis of the body, distal is away from the axis of the body. Shoulder joint to elbow joint is arm, elbow joint to wrist joint is forearm, and wrist is hand. So ulnar border, medial border of hand, or also called ulnar border of hand. Now is the ulna located in the hand? No. But we call it the ulnar border of the hand because the ulna is the medial of the two bones of the forearm. Radius is lateral, ulna is medial. These are the two bones, radius and ulna, ULNA, ulna. So medial border of the hand is also named as the ulnar border of the hand. Wherever it is written ulnar border of the hand, that means the medial border of the hand. We place it directly over the intercostal space. How do we locate the intercostal space? From the sternal angle on both sides. And we put it over the intercostal space of this. First, if we are right-handed, we first put it on the right side and ask the subject to speak something. Now, speaking anything will produce vibrations, but vibrations are more prominent when we speak some monosyllable. Like we ask the subject to repeat like this. Say 99, 99, 99. subject will speak loudly. Subject is already instructed. Whenever I put the hand, I ask you to speak, you speak 99, 99, 99. Or sometimes, if the subject, we have to instruct him or her in the local language, we ask to speak tin, tin, tin. Tin, tin, tin is 333 in Bengali. So, tin, tin, tin or 99, 99, 99. So, these will set up maximum vibrations. And the vibration is picked up by the ulnar border of the hand. Now, right away after doing the right second intercostal space, we go to the left second intercostal space. Like this, at least 6 or 7 intercostal spaces should be examined. Now, where these vibrations will come less, over where there is some organ overlapping of the lung. Okay, where there is directly air-filled lung, normal lung tissue, there will be no issue. The vibrations are well picked up. But if say, over the right lower part of the lung, the liver will be overlapping. Over some part of the lung on the left side, the heart will be overlapping. The cardiac end of the stomach will be overlapping. In those areas, the vibrations will be somewhat dampened. And over the bones, it is most difficult to pick up. So we do not put our hand directly over the ribs. We put it over the intercostal spaces. And note this is what is known as vocal femidus. So the subject is asked to speak one monosyllable, as I told. So this is what is to be noted in palpation. Shape and symmetry either to be confirmed, or if mild changes in shape and symmetry to be picked up by palpation. Position of trachea, if there is gross deviation, to be already seen in inspection, to be confirmed by palpation. And vocal femidus and apex bit also, but apex bit will take a separate class for. Now percussion. The meaning of the word percuss, to make a tap or a strike, tapping movement. So tapping movement is done with what? Obviously with the clinician's hand, but not by the whole hand. The middle finger of the dominant hand. If the clinician is left-handed, remember, if the clinician is left-handed, during starting the clinical examination, the clinician starts on the left-hand side of the patient. Mostly we say standing on the right-hand side of the patient because most of the human beings we are right-handed. But if some of us are left-handed, we will start on the left-hand side. In that case, percussion will be done by middle finger of the left hand. But usually most of us are right-handed, so middle finger of the right hand. And to percuss, over what we will percuss? Obviously over the chest wall. As we had done in case of vocal femidus, we had kept the ulnar border of our dominant hand on the chest wall over the intercostal spaces. Here also same way, we will percuss over the intercostal spaces, but keeping our middle finger of the other hand, non-dominant hand, on the intercostal space. So intercostal space, so already we know how to locate. We will locate like that. We will start from the second intercostal space and go downwards. Second intercostal space, right side, in case of a right-handed clinician, then second intercostal space of left side. Third of right side, third of left side. Fourth of. And how to percuss? The common mistake is we make the tap like this. The movement must not come from the elbow joint like this. Elbow must be fixed in air. Elbow must be fixed. For beginners, we may try to rest our elbow on a horizontal surface, but that is not actually what it is done. Elbow must be fixed. It must be learned by practice, and the movement must come from the wrist joint. And the middle finger of the other hand is on the intercostal space. And a resonating sound is obtained. If the ambient sound is not disturbing us during examination of the patient, actually ambient sound, that means environmental sound, should not disturb us. The patient is not speaking, patient or the subject is not speaking. During vocal femidus, the subject is speaking, but during this process, percussion, subject is not speaking. Only he or she is taking a deep breath out. Deep breath in, not deep breath is not required, normal breathing in, breathing out will do, and the percussion is being done. So, over air-filled lung tissue, wherever there is air-filled lung tissue, the sound which is produced is described as resonating sound. This is not vocal resonance. Vocal resonance is when the subject is speaking and we are picking it picking the vibrations up. That sound is vocal resonance. This is simply called resonance. And if this resonance is less, this intensity is less, we call it dullness. Like if we speak percuss over any muscle, say over the biceps of the subject, of any human being, or over the thighs, where there is muscular prominence, will we get any resonating sound? Compare it with a water tank, water-filled water tank. Then what will happen? Very dull sound. If we percuss over a water tank, water-filled, filled with water. But if the water tank is empty, then air is inside, then some high intensity sounds will be obtained. That is resonating sound. So in first, at least in the beginning, you have to differentiate what is resonance and what is dullness. And the implications of this in disease, in pathology disease, you will come to know in the later years of your medical school. When you go to actual wards and see patients. So now, percussing over our own friends, our subjects who are expected to be normal, there is no disease in us, so we should note what is normal resonating sounds, normal how to pick up dullness. This comes by experience. In one day clinical examination, it is not done efficiently in one day. So by repeated practice, we come to know what is resonating sound, what is dull sound. So just to give an example of a dull, if we percuss over the thigh, if we percuss over the biceps muscle, any muscular prominence, then that sound is dull. And over any air-filled cavity like the lungs, normally that sound is resonating. Now where, like we told in vocal fremitus, where some other organ will be overlapping, the sound will become somewhat dull. Okay, that much resonance will not be obtained. Resonance will be obtained where we directly percuss over the, obviously over the skin, but over the air-filled lung tissue. So this is what is done in percussion, and we will learn it during demonstration just after this briefing session. Now auscultation. So auscultation, we have to note 2 points. One is vocal resonance, as we said, that is the auscultatory corresponding auscultatory finding of vocal fremitus. Same thing we have to do, but with the stethoscope, and listen the sound with the ears. The subject is speaking out like that, 99, 99, 99, or teen like this, and we are picking up the sound with the help of the stethoscope. Vocal resonance and breath sounds. And in later years, when we visit actual patients with chest diseases, respiratory diseases, adventitious sounds are there. Adventitious means added sounds. Adventitious sounds. Names of adventitious sounds are rhonchi, wheeze. No need for now. You just know the names now. But RH, I am not writing it down. They are given in the book. No need to write. Rhonchi, wheeze are examples of what is wheeze, what is rhonchi. You will learn in the respiratory system when you examine the medicine words. So those are picked up by, obviously, by the stethoscope. So that is a part of auscultation of respiratory system. But from now on we are avoiding it. First we have to learn the normal things. So vocal resonance, breath sounds. So for auscultation we need the stethoscope, and as we have gone through the class in this topic of blood pressure, I think by now you know what are the parts of a stethoscope. So what are the parts? In the examination here you will be asked what are the parts of a stethoscope. Earpieces, body tube, chest piece. Earpieces, body tube, chest piece. Chest piece has 2 parts, diaphragm and bell. Bell is for locating or finding softer sounds. Like one classic example is fetal heart sound. The clinician is picking up the fetal heart sound over the mother's womb. Okay, that is one example of a sound picked up by the bell of the stethoscope. Heart murmurs during cardiovascular system examination. Murmurs of the heart, soft sound. MUR, murmurs. You will come to know about murmurs in cardiovascular theoretical classes. What is murmur, etc. So murmurs, heart murmurs, fetal heart sounds, these are picked up by the bell of the stethoscope. And for these respiratory vocal resonance and breath sounds, we use the diaphragm. So diaphragm and bell together makes up the chest piece. In some stethoscope, there are 2 pairs of earpieces. 2 pairs. This is 1 pair of earpiece. Same chest piece, 1 chest piece, 1 stethoscope, 1 body tube, but 2 pairs of earpieces. What is the purpose? You may be asked, what is the purpose? Two people can hear at a time. What is the purpose? Very simply just for teaching and learning purpose. The teacher is teaching the medical student, so same sound they are hearing at the time and the teacher is explaining to the student. So that is one purpose of having two pairs of earpieces, but usually there is one pair of earpiece for the clinician to hear the whatever he is trying to hear. It picks up, stethoscope picks up peristaltic sounds from the abdomen, from the GI tract, respiratory sounds, heart sounds, everything is picked up by the stethoscope. So this was invented by a person called Lennet, L-A-E-N-N-E-C. So vocal resonance, how to do? So when we use the stethoscope, we cannot put it parallelly to the intercostal spaces because those are somewhat long spaces and we cannot put this round thing over that obviously. So we divide the chest into some imaginary areas, like in the front, supramammary area and inframammary area. Supramammary, inframammary, and obviously on both sides. In clinical examination, whatever is possible bilaterally, we have to do it bilaterally. So supramammary area and inframammary areas on both sides. Okay, on the back, suprascapular and infrascapular on both sides. Two scapula on two sides. Scapula is the bone of the back. So two scapulae. So two scapula is the singular, SCAPULA. Plural is just adding one E. So suprascapular, infrascapular area on both sides, supramammary, inframammary areas on both sides, and in the middle of the two scapula, one interscapular area. So interscapular area cannot be bilateral; it is interscapular. We have to put the stethoscope over there, and also the axillary areas on the lateral chest wall, just below the axillary. In the axillary areas, these vocal resonance, breath sounds all are very prominent because no organ is overlapping. In the front and the back, some areas will be overlapped by the bone. Normal lung tissue, air, okay, everything is there, but bones will be overlapping, or organs like liver, cardiac end of stomach, these things, heart will be overlapping in some areas, but in the axillary areas, nothing is overlapping. That is an advantage. Okay, so there these sounds are most prominent for the beginners to learn how the sounds are. Learn the nature of the sounds. This axillary area is the best area to do because no overlap by anything in normal anatomy. If there is organ, there is displacement or something, but we will learn on normal subjects. We will learn on ourselves, on our own friends. Okay, so this will help us to learn what normal sounds are like. So this is about vocal resonance. The subject is speaking out 99, 99, 99. And during doing this thing, if the subject is seated, respiratory system examination can be done in any other book. I think all these are there. No need to write. So bronchial breath sounds are louder and harsher, and there is a definite gap between inspiration and expiration. Just after inspiration, there is a gap. After expiration turn, because again the air is coming out of the lung. So sound is harsh, but there is a gap between this inspiration and expiration. The vesicular breath sounds are somewhat softer, and there is almost no gap between inspiration and expiration. Whereas vesicular head sounds found over the normal lung tissue. That means over the normal lung tissue, air-filled lung tissue. Air is filling the lung tissue during inspiration, going out during expiration. During these movements of inspiration and expiration, the stethoscope can pick up these sounds. So again, where will be the best heard? In the axillary areas because no organ is overlapping. Vesicular breath sounds and bronchial breath sounds are heard over. Breath sounds you can pick it up on you can learn the nature of breath sounds even putting the stethoscope. If you have your own stethoscope on your own chest wall, on your own infraaxillary region and own trachea and large airways, they will produce bronchial breath sounds, harsher sounds, and normal lung alveoli, normal lung tissue, vesicular breath sounds. So vesicular breath sounds and bronchial breath sounds are the two types of breath sounds. So what we pick up on inspection, just quick revision: shape, size and symmetry of the chest, respiratory rate and rhythm, any obvious skin changes, scar mark, pigmentation, and position of trachea and apex beat. Apex beat we will do in one of the subsequent classes. Palpation, just confirm any gross deviation or find out any This shape, symmetry, deviation in the shape and symmetry, position of the trachea and vocal fremitus is picked up by palpation. Percussion we do how to describe, no separate points here, just we percuss and differentiate between resonance and dullness. And auscultation, we see the vocal resonance and also the breath sounds. During picking up breath sounds or testing this vocal fremitus, vocal resonance, if we are standing on the right hand side, the subject is asked to look to the other side. Just because they do not, when they are speaking, they are obviously, it is better to avoid the subject directly facing you or breathing directly over you, over the clinician. So if we are examining from the right hand side, say breath sound. So we ask the subject to look to the other side and take normal inspiration and expiration. To perform normal breathing movements. If the sound is somewhat difficult to pick up, say breath sounds are lessened, then we ask the subject to take deep breaths, forceful respiration. Okay? Then maybe we pick it up. If the sounds are very less, then it may not be picked up. Then air entry is poor in the lungs. We can say that air entry is poor. But before that, we have to learn what is normal, how to pick up normal sound. For that, ambient sound should be, environmental sound should be reduced as much as possible. Now, when you practice among yourselves, maybe when you live in the hostels or together, then you should not talk much. When you practice over here also, you should not talk much. You should try to listen to the sounds, because unless you learn what normal sounds are sounding like, you cannot pick up abnormal sounds. Okay? So now we go to the demo room. Just wait a minute, I will say, then we go to the demo room. In the demonstration.
Noise has become intolerant. Noise. This is part of physiology. Everything good and bad is part of physiology. We make noise when we do not want to listen. It is also belongs to part of physiology. I think for few minutes you keep silent. I do admit that everything in physiology is hard. But you allow me to speak something. It may be very difficult. When this repolarization wave is reaching at this point of A, then the polarity of A is different from B, and there is the membrane potential and there is action potential, and when it is in between, then there is also no difference between them, and so it will follow the isolating line, zero line, and when it is distant point B, then it is, in that case, it is negative and it is positive, so it is in the reverse direction. It is happening in this way. There is that two action potentials and the different polarity. It is called biphasic action potential. In case of a single action. Yes. We are familiar with the monophasic action potential. We are familiar with the monophasic action potential. We did that matter yesterday, monophasic action potential. And for your benefit, I am drawing that. Suppose is firing point. Here it is minus 70 millivolt and minus 55 millivolt, and it is the, and when one electrode is inside. It is the monophasic action potential we discussed yesterday in millivolt. It is zero value. It is not high. It is a monophasic action potential. It is asked in the examination. Monophasic action potential. And when the recorder, one is outside, another is inside the excitable tissue or an action, we discuss. And I think we have gone through book and you have acquired adequate knowledge. It is expected from you. Now it is the biphasic action potential. When both the electrons are outside the cell membrane, then it is the baseline is 0 millivolt because there is no potential divide. And when the depolarizing wave, that is heart approaches this, and at the point of A you get this type of response. This is positive wave, whatever. And when it is in between, then there is no difference between the charges, and it is the isoelectric point. And when it involves the B, then there is difference, but it is in the reverse direction. It is the biphasic action potential. Biphasic action potential in an action. It is asked in the examination. I examined the students of Articular Medical College and I asked them what is meant by biphasic action potential. And they are intelligent enough informed, and they give them good response. I think also you are no different, and your perception is equal to them, even not more. Biphasic action potential. Now you can ask me what should be the record in the case of a peripheral nerve, which is a mixture of action. Peripheral nerve that we are getting they are combinations of different diameter and different contraction velocity. And in that case, there is no question of going inside the cell, only outside the record is done. And what the record shows, that is the algebraic summation of the action potential. Suppose you take the action and it contains different types of action, and suppose it is a stimulator, and it is giving this type of stimulation of big duration but different in the magnitude. It is the duration and state, it is varying. So what should be the action? What should be the record? And the peripheral nerves are surrounded by fibrous tissue, epineumium, perineum, endoneum. Similar to epimysium, perimysium, endomysium in case of muscles. And that will learn histology. Now whenever this nerve is stimulated, the nerve is a combination. It is a bundle of actions of different diameters with different properties and conduction velocity. And when the recorder is close by, and in that case, suppose it is this threshold value, then there is no response. Up to this there is no value. And when it is to some extent more, then you get a small wave. And when more and more then has increased, then gradually it will increase in magnitude and time duration. Suppose in this point you get the maximal value. Then this part. Suppose this part, at that stage you are getting maximal value. This is the maximal stimulus. You can think that it is violating the all or none law, but it is not so. It contains a bundle of different types, and it is the algebraic summation. And if you take action potential recording close by, you can get this value. And maximal stimulus take suppose it is, and if it is supramaximal stimulus, then there is no change because all the fibers have been involved. All the fibers have been involved. Maximal stimulus and supramaximal stimulus, there is no change. It is attained the maximum value. Maximum change. It is compound action potential. It is the algebraic summation. Another important thing that when you increase the distance between the stimulator and the recorder, then further waves will appear. Different peaks will appear along with the distance. Suppose you take at this point, it is the recorder at this point. And in that case, you get this value is like this. And suppose at that point, then you get another peak level. Further and further you move, then there will be appearance of more peaks. This multi-peak action potential is called compound action potential. Compound action potential. And why these are multiple peaks? Because it is submerged within this volume, recording nearby. Your velocities are different. Velocity, suppose if one type of fiber, it is maximum. Suppose in A type of fiber, and it is the A type to A type. Suppose it is the another variety. Suppose it is B type. And if this occurs, then conduction velocity of A is more than B. So if you increase the distance and this separation of the waves are seen, and ultimately different peaks will happen. And from these peaks you can understand the what type of fibers they are carrying this impulse. Multi-peak action potential that is seen in case of peripheral nerves, mixed nerves. And in this way, you can suppose it is one and distance, they will separate. When the runners start from a starting spot, initially it is very difficult to separate, but as some time passes, their distance increases, and at the termination you can easily see who is first, second, third, fourth. Similarly, in this case, it is possible. This multi-peak action potential is called this compound action potential. That is found in the peripheral nerves. Now you know that during depolarization, now other parts that I should discuss. That is the depolarization of an action or a muscle is due to entry of sodium ion. Entry of sodium ion and a depolarization is to exit of the potassium ion. But their numbers in comparison to the total number present in the extracellular fluid and intracellular fluid is negligible. It can be demonstrated after repeated stimulation for prolonged period. And what are their numbers in relation to the intracellular fluid that can be calculated. By considering the capacitance and other factors. But it is pure physiology and not medical physiology. So current text ignore this. They say there is a number of ions, number of molecules responsible for the change in the membrane potential. The development action potential is minimum in comparison to the total ions that are electrolyte that is present in the extracellular fluid and intracellular fluid. But they have been calculated in different texts earlier. Third. Now another is the accommodation. 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 Accommodation is seen in case of stimulation of the peripheral nerve of the axon. Accommodation. If it is a stimulus is applied of sufficient strength and for a short time, then there is proper stimulation and the generation of action potential. But if it is a slowly active process, then it may not be able at threshold or even supra-threshold to stimulate the nerve. Suppose in this case, you see that when there is the strength and duration is low. Suppose if you taking this, if slowly given, then it will attain this value, threshold or supra-threshold value, then it will fail to generate the action potential. Whenever it is delayed or it is delayed prolonged period, then it fails to generate the action potential. It is called an accommodation. It is the behavior of the channels that is responsible for behavior of the channels. Sodium channels, you can understand. Normally, in case of monophasic action potential, when you are considering that is it is minus 70 millivolt, and when in case of a recorder, and one is at the outside and the other is the inside, and then you get that type of potential monophasic action potential. But if it is a slow process, then and when this action potential is produced at the firing level, sodium channel is too open and there is a positive feedback, and good number of sodium channels too open at the same time, so that it overwhelms the opposite tendency of repolarization, and there is abrupt rise in the membrane condition, change in the membrane condition, and it is zero and it is the overshoot is possible. But if it is slow process, in case of sodium, you will get this type of sodium conductance, and it is the potassium conductance. But if it is slow process, the sodium channel activation of the sodium channel is a short process. Activity is a very short process. At the same time, potassium channels, they are slower to open, but the duration of opening is much more, so that it may negate the value of sodium entry. So the firing level is not reached. So if it is a slow process and it may reach the threshold value slowly, then the sodium channels are opening is a short-lived process, and whenever it is a slow process, the potassium channels begin to open, and they will negate in such a way that this type of firing level that we are getting, that is the opening of the sufficient amount of sodium channels that can overwhelm the repolarizing forces is not attained. So it is not possible to activate it, and it is a property that is called accommodation. So these are the different parts I have forgotten, or I did not have sufficient time yesterday. Now we can discuss something about homeostasis. It is a relatively easy subject and it does not require much time. Homeostasis. 1.2. homeostasis. 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 Homeostasis, that is the individual, all the individuals, all the animals, living things, they are maintaining an internal environment almost constant. There is changes in the variables, parameters in the outside, but the internal environment is more or less constant. More or less constant. Some scientists cannot find this thing homeostasis. Similarly, there is another term, Millumin theory. Now, there is the homeostasis means there is the internal environment is maintained a stable state, so that we can have this function. And disturbances of the homeostasis may give rise to diseased states. And it is your knowledge of biology indicates that you know almost all. And physiology texts are, they describe these processes in a pre-chart. Every cell is surrounded by extracellular fluid. The composition of the extracellular fluid is the internal environment you take for granted. Extracellular fluid. If it remains constant, the intercellular fluid also remains constant. Of every aspect. Like the balloon. And another composition, like electrolytes, sodium concentration, potassium concentration, fluoride concentration, bicarbonate concentration, like that. Calcium, phosphate. pH of the body, oxygen, carbon dioxide, this acid, and nutrients like glucose, amino acids, fatty acids. These levels are more or less normal. And whenever it is changed, then the body tries to maintain it at the normal value. And for this reason, there is nervous system and there are multiple ways of chemical control, so that ultimately the normal state is regained. Body temperature. These are all kept constant. Maintain constant. So your text will, different chapters, they will deal, and all the systems are coming together to have this. Now, for this purpose, there are some sensors. We detect these sensors. Suppose temperature change, there are some sensors that change. Suppose there is some normal value of body temperature or core temperature. Suppose it is 37 degrees centigrade. And whenever there is some deviation, suppose it is rise or fall from the normal, then it is the deviation. And they will be detected by the sensor, temperature receptors in the skin and inside the body. And then it will, sensors will send the information to the effector. And effectors will try to correct it, correction. And then ultimately the normal value is gained in most cases. Correction. If there is exposure to cold, all in the body temperature, this correction will involve muscular contraction contraction of the nervous system and vasoconstriction. And vasoconstriction. All together they will count. Another factor, and in this way it will bring back. And if it is not possible, then the condition is the disease itself, hypothermia. An individual exposed in the cold water for a sufficient length of time may develop hypothermia, and this condition may be fatal. Condition may be. This is an example how it is happening. And in that case, this information that is called feedback mechanism. Feedback mechanism. Negative feedback, positive feedback. Negative feedback and positive feedback. Negative feedback. Negative and positive feedback. And it is the common negative feedback. Negative feedback. It is common, by means of which the normal state is restored. Suppose if an individual is remains without water for considerable length of time, we are always losing water from different sides. And whenever there is hole in the extracellular fluid, ECF free volume when it is low. ECF volume when it is low. Suppose during summer time, excessive sweating, we are losing water. So there is reduction in the extracellular fluid, and it is corrected by dividing the negative feedback. That is, it is in the opposite direction that is detected by the cells. And ultimately, it will be emitted by two ways. One is the thrust mechanism, and another is the increase in the osmolarity, there is thrust, and it is the ADH secretion release. There is secretion of thrust and also ADH secretion increases. ADH, anti-diuretic or vasopressin. It causes conservation of water from the kidney. That is, it diminishes water loss, and in thrust mechanism, water is taken in excess. They come together to produce the normal value, normal ECF volume. Normal ECF. So these are the negative feedback mechanism. Mainly it is the negative feedback mechanism. Suppose in case of hormone action, there is the hypothalamic, pituitary target organ action. In this case, suppose if there is increasing the level of the cortisol or any form of steroid is ingested, that is the glucocorticoids or cortisol. Or equivalent of cortisol when does, and whenever there is increase, then from the pituitary less amount of ACTH is secreted. Adrenocorticotropic from the anterior pituitary ACTH is less amount, and it leads to ultimately fall in the cortisol level. That is the normal value is regained in this. These are all the numerous examples. It's a negative feedback mechanism. That is the original change is challenged and it is negative feedback. Suppose if there is some reason there is increase in blood pressure in an individual, then what occurs? Bioreceptors are stimulated. Sine wave chaotic sinus aortic arch, they send information, and there will be some changes in the body. Sympathetic stimulation of the blood vessels will be less, parasympathetic stimulation of the heart and organs will be. Ultimately, there is the fall of blood pressure to the normal. And these are examples of negative feedback. But there are some cases, this original change is maintained or accelerated. Original change. And it may be beneficial, or it may be harmful to the individual. Positive feedback. Positive feedback. That is original change. Initial change is maintained or it is accelerated. So that a new state will appear. It may be beneficial or it may be fatal in some cases. Suppose if there is, due to some reason, there is blood flow in the heart, coronary circulation is low. There is ischemia, and due to ischemia, the heart will be pumping with less vigor. Pumping abilities will reduce. So less amount of coronary blood, more coronary ischemia, and it will be weaker and weaker, more and more weaker. Ultimately, it is a vicious cycle to develop, and the cardiac output may be so low that the individual is not able to survive. It is a good example of positive feedback. Due to hemorrhagic shock, there is initially fall of blood pressure, and equally and it is distributed in coronary circulation, and there is myocardial ischemia, the myocardium becomes weak, and due to weakness it sends less blood to coronary arteries, and then more ischemia, more weakness, and it is a vicious cycle to develop. এরকম হয়, ধার করছে আর শোধ করছে, আরো ধার করছে, শোধ করছে, তারপরে কি হয়, তারপরে মারামারি হয়, তারপরে দেখা যায় সুইসাইড হয়, পুলিশ খতিয়ে রাখে যে 1 টাকা ধার নিয়েছে, হ্যাঁ ছেড়ে দেহের ক্ষেত্রেও এর কোনো ব্যতিক্রম নেই। পজিটিভ নার্ভ হয় না এরকম অবস্থা, ভর্তি করার জন্য টাকা ধার করছে, কমে যাচ্ছে, শোধ করতে পারছে না, আরো ভর্তি করছে, আরো টাকা ধার দিচ্ছে, তারপর দেখা গেল টাকা যখন পাওনাদাররা চাইছে তখন আর দিতে পারছে, তখন রাস্তাঘাটে মারধর খাচ্ছে, হ্যাঁ তারপর দেখা গেল সুইসাইড করছে, পুলিশ বললো যে না এই অনেক করছে, জাস্টিফাইড। তাই এখন সেই রকম এক্ষেত্রেও পজিটিভ ফিডব্যাক এটা খারাপও হতে পারে, it may be harmful, or in some cases it is beneficial. It serves some definite purpose. Suppose if you can suppose in case of ovulation, in case of ovulation, part of the menstrual cycle, there is LH surge, luteinizing hormone. Normally, estrogen that is present at higher level at that time, it inhibits. But when the high estrogen level remains for some hours, time continuously, then there is positive feedback, more LH secretion, and in response to LH, along with the FSH, there is more estrogen secretion, and it is a positive feedback. And ultimately, the ovulation grew up. Without the ovulation, creation is not possible. So it is a beneficial. Suppose in parturition, during delivery, and hormone from the posterior pituitary is secreted, and that is called oxytocin. And when the fetus is moving to the birth canal, then it stretches, and these apparent impulses will increase further secretion of oxytocin, more powerful contraction of the myometrium. Many times, many hours left behind. Now case of parturition, there is the role of oxytocin. Oxytocin increases the uterine contraction, and when the fetus is moving, is stretching the tissue. Birth canal, and that apparent impulse increases oxytocin secretion, more vertical contraction, more secretion of oxytocin. In this way, it proceeds, and there is ultimately after the delivery, it ceases, so it is beneficial. Suppose in case of depolarization that we discussed, that is the entry of sodium ion into this cell due to the opening, and it is an example of the positive feedback and electronic potential. Suppose in case of neuron from -70 to -55, this value initial part is purely electronic potential, and after that there is a local response. There is the opening of sodium channels, more depolarization, more opening of the sodium channels, and in this way the current is reached. That is the firing level. When there is plenty of sodium channels to open to overwhelm the depolarizing forces, the action potential is generated. And action potential of the action, all the nerves and the muscles responsible for all our communication and contraction of the muscle, that is essential for our survival. So it is an example. Along with D, you can consider the case of digestive system. Cholecystokinin microgymin is a hormone. It is secreted in response to the digestive product of the proteins and fatty acids. And when the digestive process is going on, more and more CCK pituitary will be secreted, and it is a positive feedback. And when the digestive process going on and the product is moving from the upper part of the duodenum, then it ceases, and it helps in digestion. At the same time, by secretion, by the effect of CCK pituitary. So it is beneficial. Similarly, it is the case of suppose in the case of that is the seed, from the seed there is the clotting mechanism, coagulation mechanism, clotting mechanism is both the intrinsic characteristic part of it, and there ultimately there is formation of thrombin. Thrombin will stimulate the platelets and it will activate the other clotting factors, so that there is a vicious cycle, a positive feedback. In this way, more and more the effect will get accelerated, and there is rapid clotting process, and it is beneficial for the individual for hemostasis, loss of blood is prevented. So these are the examples. Chronic obstructive pulmonary disease, or by the chest OPD, you can remember these are the good examples of positive feedback. There is another mechanism, the feed-forward mechanism. Feed-forward mechanism, that is anticipated. It is one of the negative feedback. I discussed that is the body temperature regulation. When the temperature of the surroundings is going down, then the receptors they send impulses and body take protective measures so that the further fall can be tolerated, easily tolerated. It is the feed-forward mechanism. It is one version of the negative feedback. In anticipation, it acts so that ultimately the core temperature does not fall very much to 100. It is almost all about of the homeostasis, and disturbance of homeostasis may give rise to disease. I explained what is the hypothermia, and you also reading the different newspapers that many individuals died during the summer due to overheating of the body, heat hyperpyrexia due to exposure of the sun. So changes in the homeostasis may cause a disease. Some more element written in the book. I am stopping here. You are preparing your mind for an examination. Thank you.